morning, everyone. I am glad to welcome everyone this morning. We are at almost 40 attendees so far, according to our ES, so I'm going to get us started. So to begin, good morning, ladies and gentlemen, our special guests, PEEF Chairman, Board of the Trustees, the conference chairperson, the session facilitator, our fantastic speakers today, and all our participants. My name is Ahmed Mohammed, and I welcome you to the 8th Annual Conference organized by PEEF, where we focus on this year's theme, management of mental health, wellness, self-care, critical issues and practical solutions. Let me begin by saying that on January 5th, 2023, Nigeria achieved a historic milestone in efforts to improve support for psychosocial well-being by enacting the National Mental Health Act 2021. This brings to fruition a 2-decade-long effort to replace an outdated mental health legislation. This landmark achievement placed Nigeria among the few African countries that have responded to the World Health Organization's call for legal reform aimed at eradicating human rights abuse against those with mental health conditions. This progressive development really arrives at a crucial stage when the recognition and advocacy for the rights of individuals with mental health conditions in Nigeria is stronger than ever. PEEF's conference this year serves as a platform, or as a key platform really, to discuss the implications of this policy, share best practices, promote alignment in implementing effective mental health strategies. A core focus of the conference today will be addressing the stigma attached to mental health issues, fostering greater understanding and encouraging mental health program initiatives. We have here today experts from a very diverse background who will share knowledge, experience, and practical approaches to mental health delivery, including integrating services into primary health care and community-based support systems. PEEF aims to foster these collaborations today and moving forward to enhance resource sharing and create comprehensive strategies for mental health management in order to promote a sustainable and impactful change across Nigeria. So before we proceed, let me give an overview of PEEF to those of you who are joining us for the first time. Some of you may know PEEF already from previous engagements, but I'm sure there are some new folks here today. I would love to give a brief overview before we get started. PEEF, the People Expertise and Excellence Foundation, is a registered nonprofit organization that addresses skills management challenges in Nigeria and across Africa. It was established initially as a skills discussion group in 2016 for sharing information and professional networking. However, PEEF now aims to be the leading and most respected organization championing skills development across Africa. Our mission is to enhance skills proficiency and foster productive work across the African workforce, guided by the core values of professionalism, integrity, sincerity, productivity, and excellence. PEEF is committed to the following objectives: distributing up-to-date information on skills management trends, developing innovative techniques to boost productivity in Nigeria, raising skills management awareness throughout Africa, supporting workforce development, and promoting Africa as a valued source of skilled professionals. Previous PEEF conference themes have included themes like framing strategic skills management issues for accelerated development in the transportation sector. In the past, we have also done, we've also had the theme of education versus reality, bridging the gap between the education system and the real world, which is actually one of my favorite sessions, by the way. We also had universal healthcare coverage. We had a nice conference on that, the challenges and expectations of universal healthcare. There was a session on strategic leadership and economic rejuvenation, and skills readiness for development of the African economy. I actually remember that very well because that was done in the middle of COVID, which is an interesting. We had some special guests, including ones from here in the U.S. Universal healthcare coverage again, but this time with a focus on prospects and challenges. And finally, or lastly, we had accelerating steel sector development in Nigeria, achieving zero corruption in procurement management, which was also a very exciting conference. In addition, and in alignment with PEEF's mission, we also have what we call the PEEF Virtual Talk, which is a series. This is an online platform for periodic conversations led by subject matter experts from various industries and economic sectors. This is a series where we're able to share valuable knowledge, highlight best practices, and address developmental challenges across different areas through collaboration and active problem solving. So really exciting program there. If you want to learn more about PEEF and the work that PEEF is doing, and if you want to also become a member of PEEF so that you can access all of PEEF's benefits, you can certainly visit our website, www.peef.ng. There's lots of information there. We will post that in the chat room so that folks are able to access, and you can also join the organization as well. So I hope you take the time to do that. Now, without further delay, I've told you a lot about, I've started with a good introduction about PEEF. I've given you some additional information about the conference, the background of this conference today. I am honored to introduce one of our special guests, Alhaji Abdallah Bukar, the chairman of the board of trustees at PEEF. Alhaji Bukar has over 46 years of extensive experience in the oil and gas industry. His career spanned various engineering and field operations management roles across Nigeria, Holland, Australia, and more, culminating into his retirement as a general manager of engineering for all shell companies in Nigeria. Alhaji Bukar is celebrated and credited with successfully delivering on major and redevelopment projects across multiple locations globally. His dedication to fostering professional development among Nigerian professionals has been evident throughout his career and continues through his current role as the chairman of the board of trustees at PEEF. Please join me today in welcoming Alhaji Abdallah Bukar to the conference as he shares a few words with us before we move forward. Thank you, Engineer. The floor is yours.
Thank you very much, Ahmed. Very good of you, and you have said really most of the things I would like to say. So let me start by going on protocol. I'd like to welcome other members of the Board of Trustees, the Honorable Secretary, the conference leader, the conference chairman, engineer doing in a talk about mental health. Well, this is one of the conundrums that people who join PEEF will have to try and square up. As has been said by Ahmed, PEEF is a foundation that looks at skills and tries to integrate across the whole society so that we are able to provide a platform that will allow people to excel and will allow skills management and ensure that the country and indeed the whole world has an avenue where you can address issues across. And as you heard from Ahmed, we have not only done conferences like this, but we've done PVTs, which have been extremely successful in disseminating information and getting people to understand what is going on. Today's session is very special. Like Ahmed has said, mental health is one of the few not so much talked about part of the normal health delivery programs in most countries. I'm sure everybody will hear all efforts about malaria, about monkeypox, about all others, but you hear very little about mental health. And this is actually as important as the physical health. And it is our hope that events like this one will help to highlight and point out that this also requires the same level of care that has been given to other sections of the health system and also needs to be addressed fully because it affects everybody across the skills. And the symptoms may not be picked up as easily as many of the others. We have got lined up for you quite a raft of very good speakers who will take you through a very nice program. I wish you success, and I ask for your complete attention to listen to it and ask questions at the end of the session. And I'd like to say thank you very much for being with us today, and we hope you will enjoy and will also show what you have learned here to others who may join the PEEF, and would like to say thank you very much. But let's listen to our guests and have a good session. Thank you very much, and over to you, Conference Chairman.
Thank you so much, Chairman, for that wonderful goodwill message. Next, I would love to introduce, or it's my pleasure to introduce, Dr. Edwin Bako. He's our esteemed chairman of the conference today. Dr. Bako is the current CEO of Peak Wellness Center in Nigeria and carries a wealth of experience from his prior role as the group general manager of the Nigerian National Petroleum Company, NNPC's medical services. He's also a founding member of PEEF with professional interests focused on early detection of occupational diseases and quality in healthcare, with recent engagements in interactive medicine. Please join me in welcoming Dr. Edwin Bako, our conference chairman for today, to also say a few words.
Thank you very much. Thank you very much, moderator. Our chairman, board of trustees, members of the board, and executive management of PEEF, guest speakers, and distinguished conference delegates. A very good morning to you all. It is indeed a privilege to be with you at this important conference where we gather not only to share knowledge, but to confront some of the most urgent and transformative challenges of our time: the management of mental health, wellness, and self-care. Mental health has for a long time been a taboo for open discussion. But today, we all stand together to confront the issue head-on as part of a global movement to change the narrative. Ladies and gentlemen, together, we have the power to lead change in reshaping the way we think about mental health, to reimagine wellness, not only as an afterthought, but as daily practice, to redefine self-care as a vital, non-negotiable tool for living a life of meaning and balance. So what are the issues? I'll just enumerate a few because there are so many. Mental health issues today has assumed enormous dimension, that it is no longer just statistics, but real lived experiences. Depression, anxiety, burnout affect millions of people around the world. People in our families, in our classrooms, in our workplaces, and our communities. One of the rising issues, mental health issues currently that is ravaging families is the issue of mental illness coming from substance abuse. And now more recently, the effects of social media, especially on children. As I mentioned earlier, the statistics are staggering, and it is stated that 1 in 4 people will experience a mental health issue at some point in their life. For many, the journey towards recovery is long, and the support they need remains out of reach. I personally tend to think that we all experience some mental health issues in our life, all of us. But interestingly, some people are able to get in and get out of it pretty quickly as if nothing has happened. And for those who are not that fortunate, they are the ones that recovery becomes more difficult and they need support from the rest of us to keep on going. Now, mental health has been treated as secondary to physical health, when in actual fact, the two are inseparable. We cannot be whole if our minds are neglected. We cannot live fully if our mental well-being is compromised. In fact, you need a sound mind to be physically fit. Everything actually begins with the mind. So let's look at what's happening. There's an absolute need for a paradigm shift as we shift into an era where mental health is being given the same respect and urgency as physical health. We are seeing a growing number of people recognizing that wellness is not just the absence of disease, but the presence of positive mental, emotional, and physical states that allows us to thrive. Today, we are standing at the threshold of something profound, an opportunity not only to manage mental health, but to actively foster well-being, an opportunity to practice self-care in ways that protect our minds, rejuvenate our spirits, and enhance our lives. This particular conference, I should say, as with many others, calls for action. And as we look forward, there are critical issues we need to address together. One of the very first issues that we need to look at is the issue of stigma. And despite progress made, mental health remains a topic shrouded in shame and fear for a lot of people. This stigma prevents individuals from seeking help, from speaking openly about their struggles, and from recognizing that they are not alone. We need to dismantle this stigma through awareness programs, through advocacy, through various community engagements. I'm sure we'll hear a lot of this from all our eminent speakers that are here, and I'm sure they'll do justice, not only to the stigma aspect, but to the other aspects that has to do with our mental health. Then we have the issue of access to care. Too many people, particularly in underserved communities, still face barriers to accessing quality healthcare. I might add very quickly that this isn't only for underserved communities. Even those in well-established communities, those in the large cities, etc., etc. Access to care has been difficult. The National Insurance Healthcare Service has not been widespread enough, so we have a lot of people that are not insured. And paying out of pocket has been one of the major problems in accessing care, not just mental health, but all-round care. Next, we go to the workplace and academic environments. I'm sure our speakers, again, will delve on this a lot. As you all know, the workplace places excessive pressure on individuals, leading to stress, burnout, and mental fatigue. How we redesign our systems to encourage wellness rather than contribute to exhaustion is something we need to look into. Then we have the role of technology. Technology plays a complex role in our mental health. Interestingly, while it connects us, it also isolates us. While it informs us, it also overwhelms us. We live in an age where information comes at a rapid pace, and social media, as I mentioned earlier, often fosters unrealistic expectations of success and happiness. How we create balance here is also crucial to the improvement of welfare, mental health in our communities. So, what is the roadmap? Now, as scholars and members of the public, we are here not just to discuss the problems, but to find solutions. So let me share with you some practical, actionable steps that can make a difference, both individually and collectively. Number one, we need to prioritize mental health organizations, mental health conversations. The initial step to change is always conversations. We need to talk about this. It is no longer something that should be shrouded in secrecy. As scholars, leaders, and advocates, we must continue to talk about our mental health openly, regularly, and with compassion. We need to create spaces where people feel heard, supported, and encouraged to seek help when needed. We need to invest in holistic wellness. Wellness is more than just the absence of mental illness. It's about nurturing every aspect of our being. Regular physical activity, healthy eating, restorative sleep, and mindfulness practices are all foundational to mental health. We need to encourage our communities, our families, our students to embrace these practices. Wellness must be built into the fabric of our lives and not just tacked on as an afterthought. We need support resilient systems. Workplaces and educational institutions are key environments for shaping mental health. Let's create systems that prioritize well-being, systems that offer flexibility, support work-life balance, and provide access to mental health resources. As scholars, you are in the perfect position to advocate these systemic changes, ensuring that mental health is woven into the fabric of our organizational structure. Then we need to make, fourth point is that we need to make self-care a collective responsibility. Self-care is not a solo endeavor. It's something we must all embrace together. It is about taking time for ourselves, but it's also about building a culture of care within our communities. We need to check in on each other, create spaces where people can practice self-care without guilt, and encourage one another to set healthy boundaries. And fifth, perhaps not the least, is how we need the need for us to harness technology for good. We need to use technology to our advantage. We can create digital platforms that promote well-being, mindfulness, and emotional support. Let's explore technology to connect with us and the resources we need, from telehealth services to online wellness program. And let's learn how to set boundaries with our devices so they enhance our lives rather than overwhelm us. To conclude, ladies and gentlemen and eminent speakers of this conference, moving beyond rhetorics, I'm filled with the hope that we can change the narrative if we truly desire it. We have the knowledge, the passion, and the ability to make a real difference in the lives of countless individuals. We're the ones who can create a world where wellness is not a privilege, but a universal right. And we are the ones who can ensure that self-care is not a luxury, but an essential practice for everyone, everywhere. Together, let's embrace this challenge. Let's be the generation that not only talks about mental health, but champion it. Let's work side by side to create a future where mental well-being is celebrated, nurtured, and protected for all. I'd like to thank all of you for your attention and revert back to the facilitator. Thank you. Thank you very much, everyone.
Thank you very much, Doctor, for that wonderful and great pre-introduction to the conference this morning. Next, I am delighted to now introduce to you our esteemed session or technical facilitator, Dr. Onyekachi Ogunye. Dr. Ogunye is a distinguished fellow of the West African College of Physicians, Psychiatry, and has served as a consultant psychiatrist at the Federal Neuropsychiatric Hospital in Enugu. Currently, he is based in the UK, practicing as a specialty doctor in old age community mental health with the Birmingham and Solihull Mental Health NHS Foundation Trust, where he holds the position of medical staff governor on the Council of Governors. Dr. Ogunye has a rich history, having held several leadership roles within the Nigerian Medical Association, NMA, and the Nigerian Association of Resident Doctors, NARD. His past roles include serving as the NMA's public relations officer in Enugu State, Nigeria, chairman of the NMA Enugu State East Zone, and the National Committee Chairman of NARD on medical outreach. Additionally, he has also served as the president of the Association of Resident Doctors at the Federal Neuropsychiatric Hospital in Enugu. Please join me in welcoming our technical session facilitator today, Dr. Onyekachi Ogunye, as he leads us through today's session. Thank you very much.
Hello, good morning, everybody. I don't know if you could hear me. Thank you so much. It's a privilege to be the facilitator for today's program. It's an honor. Please, I want to make sure that my voice is loud enough. Can someone tell me?
Yes, we can hear you. You sound good. Great.
Thank you. Just I won't go through what's been said, but I have to, as a matter of respect, welcome and appreciate the chairman board of trustee PEEF, other members of the board of trustee, the PEEF family in its entirety, the conference chairman, and our erudite speakers, as well as the audience. My apologies, Mr. Ahmed Mohammed. You've done wonderful this morning. Thank you so much. So I'm going to pivot the sessions going forward, and I want to announce some basic house rules. The first is that we'll make sure that we remain muted. This is automatic, but if by chance you're not muted, please mute, because interference may actually affect what we're doing today. There will be opportunity for question and answers. The lectures were supposed to have the session, question and answers, at the end of each, but the way we're going to do it is after the first 3 lectures, we'll have opportunity to ask our questions and have the speakers answer. Then we'll do the last 3, and then we'll have another session for a question and answers. Can I remind you that you have the opportunity to write down your questions, and at the end of the first 3 lectures, you ask it, or if you're not comfortable enough to ask it directly, please drop your questions in the comment section. When we get to the question and answer section, please raise your hands if you have something to say. We'll be able to recognize you and give you the opportunity to speak. Can I also remind you there will be an opportunity for 5 to 10 minutes break in between maybe after the first 3, we'll have 5 to 10 minutes, then we'll continue. If that is said and understood, I don't know if anyone has a question at this point before we continue. All right. Today's program, remember the theme is management of mental health, wellness, and self-care, critical issues and practical solutions. And just like the engineer said, the board of trustee chairman, what would an engineer be doing with mental health? Understandably, I'm very happy that PEEF chose mental health as a theme for this year, because if we look at WHO that says no health without mental health, we understand how important mental health is in our lives. Again, when the conference chairman was giving his speech, he mentioned about stigma. This is the point that I'm quite interested. I want to tell all of us here that stigma is something that lives and stays with mental health. It's been there for years, and everybody is making efforts to eradicate it, but it's still there. Even the Western countries are investing a lot of money to be able to combat stigma. Those of us in mental health practice face stigma every day from even colleagues in the profession who are not in mental health, from the general public, from our families, from our friends. Some subtle comments we get every day, however nicely they may have been put, are coming from the background of stigma. I'm very happy that today we are dealing with this. We'll be able to talk about it just like the conference chairman said. The first stage is speaking up, and we'll be able to go ahead and have solutions to this. I'm going to introduce the first speaker today, and if you understand, if you have the program, the first topic we're discussing today will be empowering communities and workplace, a holistic approach to the mental health awareness. And with this, permits me to introduce the first speaker. Sorry, can you trying to share this? But if I can now, I'll be able to just go ahead and talk about it. Right. Can you see my slide?
Yes, we can see it.
Yes.
Yes.
Yeah, thank you. I'm going to introduce Dr. Fumi Agwocha. Dr. Fumi Agwocha is an assistant commissioner of the Office of Behavioral Health Promotion and Prevention, Boston, Massachusetts Department of Mental Health. A very dynamic leader who has been involved in a lot of leadership positions for over 2 decades. And she has a background in organizational psychology and healthcare leadership. She's dedicated to implementing transformative strategies in behavioral health. She was the Chief Operating Officer at the Brooklyn Center for Community Mental Health. She led the system change, drove strategic growth, and oversaw school-based program. So we have a strategic leader today telling us about this wonderful topic, empowering communities in the workplace. She is also an adjunct faculty member at William James College. She teaches there organizational and leadership psychology, contributing to the field through education. She holds a PhD in holds a doctor in psychology in organizational and leadership psychology from William James College, an MSc in applied educational psychology from Northeast University, and the BA in psychology from the University of Massachusetts. Her commitment to health equality and ability to navigate complex healthcare environments have made a lasting impact on mental health services in Massachusetts. I am pleased to welcome you, Dr. Fumi Agwocha, to this this year's PEEF program.
Thank you so much for that warm introduction. It's a pleasure to be here. And I'll go ahead and share my slides and as we begin the conference this morning. There's already a lot that has been shared to really buttress the reason why we're here today. And by a way of introduction, I'm speaking while I'm trying to share my slide here. Just give me a second.
Dr. Agwocha, I'm sorry to interrupt you.
Yes.
Something I missed while telling us about the house rules. Each lecture is expected to last for 20 minutes, and they will be able to take up the extra time to join to the question and answers at the end of it. All right, thank you.
All right, thank you so much for that. Like I said, by way of just starting off this morning, I want to say thank you to the organizers of this conference, particularly for the invitation that I got from Mr. Ahmed Mohamed and Dr. Rabiu. By way of just adding a little bit, I love to share the story of how I started in the field of psychology. My path came from childhood, right? I grew up in the northern part of Nigeria, in Bauchi State, and a family friend started college and was experiencing extreme mental health challenges. And he went ahead to use substances as a coping mechanism. And that led to a lot of challenges for him and the ability and lack of ability to complete his education. And that left a lasting impression for me. And I felt this is, my calling to really think and make changes within the mental health space and really looking at how we can create commitment to psychology and mental health and improving the healthcare systems. And so having to come back after 2 decades of work to really present is really an honor for me. So I'm happy to be here and to share some of my knowledge in the last 2 decades. Here is our agenda for the day. I'm not going to go into that because we'll be walking through all of this later on. So starting off, we're here to talk about mental health and mental wellness. And it will behoove us not to really understand what the definition of mental health is. To the chairperson, the chairman who spoke ahead talked about stigma, right? And when we think about mental health, we automatically relate it to stigma. But looking at the World Health definition of mental health, it's a state of well-being where individuals realize their abilities and can cope with normal stress of life and can work productively and fruitfully within their communities and contribute meaningfully. So the need to move away from stigma associated with mental health is huge. Mental health is more than the absence of mental health diseases or challenges. It encompasses our emotions, our psychology, psychological well-being, social well-being, as well as it's a state of wellness that we experience across a lifespan. Good mental health does not guarantee the absence of mental illness does not guarantee good mental health. And similarly, having a mental health does not preclude you from having a positive mental health. So it's important to ensure that we include life satisfaction, self-acceptance, a sense of purpose, identity, feeling connected, a sense of belonging, and empowerment and resilience as part of our framework around mental health. Why is mental health critical? Mental health is the fundamental aspect of our life. It's really profoundly influenced how we think, how we act daily. It impacts our emotional, our social well-being, in fact, how we show up at work. And so it's really important that we pay attention to our mental well-being. Earlier, it's already been said, the connection between mental health and physical health. Actually, most of our physical health conditions are associated with mental health. So increase in stress levels has been associated with depression, with anxiety, but also linked with heart conditions, respiratory diseases. And so the need to really take care of our mental health is not just something to think about as secondary, but it's really a primary focus in our day-to-day life. So let's look at some data across the globe here. 1 out of 8 people experience mental health across the globe. And with that, a total of 1 billion in the world has a mental health disorder. And bringing it back to the United States, for example, 1 out of 5 experience mental illness, making it an annual overview of 52 million people as of 2020 alone experiencing mental health issues. The other thing that was mentioned earlier is the significance of even suicide, right? 1 out of every 100 deaths is related to suicide, which is associated with mental health disorders. And we also think about the economic impact that mental health disorders brings into the economy. In the United States, for example, about 192 billion in loss of earning as a result of mental health. So this not just affects the local families or communities, it's a global, it's a national impact as well. Now bringing it home here, the trends is really jarring. You can see that through my slides, but I think it's been mentioned by the chair that the need for access to care is critical. So 80% of individuals with serious mental health needs in Nigeria cannot access care. And that's one that we need to underscore. And how do we shift the trajectory around that? One of the work that we do here in the United States, especially in the states that I'm currently in Massachusetts, is really improving on what we call community health centers. The community health centers are government funded and federally funded so that everyone can have access to care. I think the facilitator mentioned that earlier on in terms of really thinking about an holistic approach to how we think about care. So one, there are medical, there's dental, there's behavioral health, there's eyesight. The need to create centers like that in the community to help give easy access for members of the community and also providing subsidized care is also critical. So to the point that this conference, I'm hoping, will also give us opportunity to begin to think about strategies in which to improve mental health accessibility in our communities. So protective factors are critical. I love to talk about protective factors because they are the characteristics that individuals, families, and communities, and I would say nationally as well, have to help individuals manage and reduce mental health conditions. And so, and support overall well-being. So what are those protective factors in our communities? What are the social supports? What are the community programs? What are levels to access to services? One of the things I would say that in Massachusetts, for example, we constantly, given the melting pot of the state, have to think about various protective factors in each community. Specifically, I would say to Nigeria, bringing it here, I would ask that as you're thinking about this, think about your individual level of protective factors. What are the emotional regulative skills that you have? What's the level of your self-esteem? On the family level, what are some of the positive relationships? What's the family support systems that has been created? At the community level, what are the safe spaces, the social network? One thing that I would say that is a huge protective factor that we should keep in Nigeria and in our communities is our resilience to you know, Nigerians and the diaspora. One of the things that they really talk about us and our ability to adapt is resiliency. And so really honing in on that. The other thing is really thinking about our culture and our religion. And going back to resilience, and I know that this will really connect with our guests and, you know, members of the conference today is the phrase Naija no go carry last, right? We say that because we know that that gives us momentum. So I'm giving that as an example of what protective factors are and really recognizing that and leveraging it, you know, and really owning in on how that could help sustain your ability to live well and to work well as well. Social determinants of health are really critical in our communities, in our workplaces. They help to contribute to or detract from the health of individuals and our communities. What are social determinants of health? Social determinants of health are important because they help to create the frame in which is associated to mental health conditions. So economic stability, access to education. I would say for Nigerians, access to education is also a protective factor because it helps to stabilize the community. What are the social connections? What is happening on the community level? We've talked about access to healthcare already. Is our community safe? Do we have good roads? These are all social determinants of health. One of the critical factors to social determinants of health in Massachusetts, for example, is really within the marginalized communities where people don't have access to all of these things readily. And so really emphasizing and building structures that will create economic stabilities, access to good jobs, access to schools, and improving on the education, income, and occupation and living standards significantly impact health and well-being. I really want to emphasize or underscore the need for strong family relations with family, friends, and communities as well, because the lack of that leads to social isolation, leads to loneliness, and the recent Surgeon General report is indicating, especially even in the United States, as loneliness is a significant risk factor. And so in Nigeria, where gathering together, having our parties, those are things that really get us going, and increasing those levels of social connection should not be reduced in any way. We should find ways to continue to connect, and that helps to improve mental well-being. I want to do a quick dive to the framework of mental health promotion and prevention and talk a little bit about my office. I know that the nation of Nigeria recently changed its legislative writings around mental health. And so the Office of Behavioral Health Promotion and Prevention is also a newly created legislative office here in Massachusetts to promote behavioral health across the Commonwealth. In partnership with our executive office, the role of this office is really to create sustainable population level change through upstream behavioral health promotion and prevention. And what do I mean by upstream? Really thinking about ways to create campaigns, education that would help change the trajectory of mental health. Massachusetts is ranked the first, actually, with access to mental health. And we're still doing a lot to really create more access points for mental health services. The vision of this office is really to create behavioral health promotion and prevention where it's woven into community life, fosters resilience, empowerment, equitable access to behavioral health resources through evidence-informed, trauma-informed, data-driven approaches. And we strive to create a community or culture where everyone in the Commonwealth can thrive. And really making that our vision and our mission as forefront, I think it's critical to help ensure that we're really thinking about the programs and initiatives that is coming out of this office. As we think about the continuum of intervention for mental health, one of the frame that I want to bring to mind is that promotion of behavioral health should happen across the continuum of interventions, right? Looking at from prevention to early intervention to treatment to community care services or recovery services. So mental health promotion focuses on enhancing the quality of life. Prevention includes universal selective indicator, which I'll go into in a moment. But this frame ensures that we're really looking at a continuum at every given time. The need to ensure that we're creating upstream prevention and early intervention is critical, and that's where my office comes to play within the Commonwealth of Massachusetts. So why is promotion of behavioral health or mental health critical? There is a need to create strategies and design services for individuals and communities to improve overall well-being. This include enhancing the protective factors that I mentioned earlier on. How do we continue to create space and room for social support, for positive relationship, for resilience. Examples of those are prenatal and early childhood intervention, because this sets the foundation for lifelong mental health. Community-based programming, such as public awareness campaign to reduce stigma, support systems for early parents or elderly, creating trainings around mental health first aid, school-based intervention, looking at social emotional learning curriculum, anti-bullying, education around the use. So these are all various promotional activities that could happen in our communities as we think about bringing more promotional interventions to the communities. I would also say that really creating an environment where schoolwork and communities can promote mental health through policies and practices. Those are also critical as well. And so when we think about this approach, we have to think about it from an holistic approach, looking at multi-level from individual to governmental intervention. Each level builds upon itself, supporting each other and creating a comprehensive system. This framework creates a multi-strategy process that requires dynamic support systems. So what do I mean by that? The creation of my office is a governmental initiation or initiatives. And with that, we'll create grants to organizations, to community-based organizations who now create supportive programs within the community and then affect families and individuals. So that's the multi-level approach that we have to think about. And there are key 4 success factors here. There has to be long-term commitment across all of this dimension. There have to be collaboration and partnership. It cannot be done from a place of silo. There has to be a need for cultural competence, right? So that is a huge issue in the diaspora here, is that it's a melting pot. So really understanding the cultural competence for each representative cultures within the communities is critical. And you know, thinking about Nigeria, we have multiple ethnic groups, multiple languages, and ensuring that the services that we're bringing in encompasses that, and making sure that there's accessibility to all of these resources as well. So when we think about prevention, focusing on prevention is really looking at creating initiatives that addresses mental health conditions before they happen, right? Before the occurrence of the mental health issues, with the aim to reduce people's exposure to high-risk factors, such as substance abuse and other, you know, negative protective factors that is being used in our communities today. You know, we have to identify risk, and so what are those risks? Some of it are genetic predisposition. What are the environmental that or lifestyle choices as well that really impede our mental well-being? So prevention is looking at a 3-pronged approach. There's prevention, there is secondary prevention, and there's tertiary prevention. When we think about primary prevention is promotion. So I'm not going to speak more on that, but secondary prevention at people with behavioral health issues, really targeting that population before it becomes severe. So really understanding your genetic predisposition is critical for our young people in schools, thinking about early screening and early intervention, and providing educational literacy on mental health is critical for this population. And then tertiary management or prevention is really looking at integrating services that could help establish more accessibility for those with existing predisposition to mental health. So really taking those levels of prevention helps to address mental health and behavioral health from a multi-pronged approach. And here is just really looking quickly at the various prevention foundation. The universal preventative intervention is really looking at approaches that cut across for the general public. Like I said earlier, mental health substance use curriculum in our schools system is a good universal approach. And when we think of our communities, what are some of the generic or general educational services that we can provide at a community level? For the selective prevention, we're really looking at our subgroups that are already predisposed and really thinking about effective services for that. So, for example, families that have experienced substance use might be a selective, or families that have experienced or children that have been exposed to violence. So those are selected groups that are high-risk groups that need attention before their illness become exacerbated. A multi-pronged approach to mental health and behavioral health wellness. And moving to mental health in the workplace. Mental health in the workplace is essential for productivity, for innovation, for people to thrive. The workplace is critical environment for promoting mental wellness and addressing challenges. Addressing mental health in the workplace does not only benefit the individual or the organization, but it benefits the entirety of the economy of the community, the state, and the nation. So understanding the current landscape, I spoke about our earlier data that 1 out of 5 adults in the United States experience mental health conditions. And what does that mean to the workplace? The cost to the workplace is in billions of dollars because of loss of productivity every given year. So why is it important to really prioritize mental health in the workplace? It increases productivity. Employees are able to perform better when they feel supported, when they feel their mental health is invested on. There's retention in the workplace. Supportive mental health culture reduces turnover and absenteeism, increases innovation and creativity when people feel psychologically safe. As a leadership and organizational consultant, this issue of psychological safety is what I bring to organization in terms of training and development and really creating a collaborative space within the organization. It also improves the organization's reputation, right? When you have retention, when you have increased productivity, there's likelihood that your reputation as an organization will increase and you'll be able to retain more talent. Workplace mental health challenges are enormous. We think about the growing concerns of stress and burnout, and my next slide will focus a little bit on that. The need to shift our organizational culture. What is the work culture within an organization? A toxic or unsupportive environment, including lack of leadership support, or unclear expectation, unclear roles and responsibility can exacerbate mental health issues. So addressing work-life balance, right? The stigma associated discrimination. One that I would like to point out when we think about discrimination is also harassment. Is there workplace harassment or sexual harassment in the workplace? All of this.
Hello, Dr. Gocha. Hello, Dr. Gocha. Sorry to interrupt. Just calling your attention to time. We're already 4 minutes beyond time, right? Just to let you know.
Yeah, I'm wrapping up. and really making sure that, you know, we put all of this to frame. So just wanted to buttress the point here that the Mackenzie Health Institute of Employment looks at well-being and really what are the contributing factors to burnout and stress. So toxic work environment is the leading factor to both burnout and stress. You can see that 70%, 90%. So the need to really understand what is leading to toxic workplaces is critical in terms of understanding workplace mental well-being. I would like to point us to the best practices for workplace mental health. The one that I really want to underscore today is leadership and the commitment to cultivating organization culture that really prioritize psychological safety. If leadership does not prioritize mental health, it's not going to happen. So there is a need for leaders to create models around empathy, prioritizing mental health, fostering an inclusive environment where employees feel valued and supported, and then really creating other workplace structures within the workplace to prevent and support systems around mental health and well-being. And finally, I would like to talk about what we think as we approach an holistic solution to communities and workplace mental health. There's a need to look at multifaceted approaches, and taking the first approach is launching promotion and prevention program. $1 spent in prevention and promotion, the studies shows that reduces up to $4 to $6 impact in treatment. So for us here, I think one of the things we really need to think about is how do we emphasize promotion and prevention. The reduction of stigma is another, really developing sustainable public health systems. In Boston, for example, or in Massachusetts, we have the Department of Public Health, we have the Department of Mental Health, Department of Youth and Services, really thinking about all these holistic approaches from a governmental level that then shift into our communities and then to the individuals. Building mental health systems, the use of data. I think it's really critical to understand how data is being used or how well we're collecting data, and those data can help inform the levels of programming and policies that we're creating in the workplace. With that, comes to an end of my presentation, and thank you all for your attention and looking forward to hearing questions. I know we'll be taking questions after our presentation.
Thank you very much, Dr. Fumi Agwocha. That was very wonderful, and I'm sure our audience have noted their concerns, comments, and contributions. Can I remind our audience that after the next two lectures, we'll have an opportunity for questions and answers. We move straight to the next lecture, which is Community Psychological Substances Model, an integrated approach to mental health care in Africa. However, before I do that, I have to, Dr. Musa Mawe, I have to introduce one of our very important guests today. We have Professor Henry Okeri, MNI. He is the Deputy President South of the Pharmaceutical Society of Nigeria, representing the President of the Pharmaceutical Society of Nigeria, pharmacist Tanko Ayuba. Professor Henry, please, we welcome you and ask you to please spend some few minutes to give us your goodwill message.
Thank you very much. Are you hearing me?
Yes, please.
Okay. The Chairman, Board of Trustees, Conference Chairman, organizers of conference, eminent speakers of conference and delegates, ladies and gentlemen. I've been here since 10 o'clock anyway. I've been following the proceedings and it's been enlightening. I thank you all for a well thought out team, mental health, wellness, and self-care that is critical at this time of our national life. This team is very apt, especially in the face of current harsh economic realities. And truly,
Please, can we put on the video? Please put on your video.
well, I was trying to do that, but
If you hover over your screen, you will see the camera sign. Just click on it.
It's bottom left. Bottom left of your screen.
hello.
We can hear you, but we can't see you yet.
Oh, very unfortunate. I'm trying to, my video is not connecting. I don't know why.
Okay.
Okay, please just listen to the audio.
That's okay. Go ahead. Go ahead, Prof.
Okay, okay. So I was saying that the theme of the conference is apt and is a well thought out theme, especially in the face of our current harsh economic realities. Mental health, wellness, and self-care are actually interconnected. And from the lecture so far, of course, we know that mental health refers to the emotional, psychological, and social well-being, which actually affects the way we think, the way we feel, and the way we act. Mental health and wellness that we are addressing today enables us to make sound judgments and able to handle stress, especially, like I said, in the face of current economic realities and global meltdown. The other leg of the team, which is self-care, is also very important. This is because people need to be intentional to be able to improve their mental, emotional, and physical well-being. And this can be done through regular physical activities like exercise, healthy eating, good hygienic practices, good relaxation and sleep, and as well as good social networks and interrelationships. All these will help each and every one of us to improve our mental resilience, which is very, very important, especially in this time of our national life. In these challenging times, we actually need to prioritize the vital elements of this team, which are mental health, wellness, and self-care. This is important because they are necessary for us to be able to properly navigate the complexities of our national life. I will want conference to scale up the outcome of all the various deliberations because they will actually be of great benefit to individuals, communities, and whole of society. Finally, I would like us to know that we need to encourage self-help practices and support one another through empathy, compassion, and understanding. Let us please take care of ourselves and also help to take care of others, because this will help in actualizing the focus of the team as we have actually listed. I wish conference the best of deliberations. I can assure you that I'm actually enjoying the proceedings, and I send you high regards from the President of Pharmaceutical Society of Nigeria, Pharmacist Ayuba Tanko Ibrahim, FPSN, who is unavoidably absent because of other pressing official engagements. My warm regards to all of us, and God bless. Thank you very much.
Thank you very much, Professor Kerry, for your wonderful speech. You were quite concise. Thank you. God bless. We move quickly to the next topic, which is a community psychological support services model, an integrated approach to mental health care in Africa. This is going to be delivered by our erudite speaker, Mr. Ndi Ezemgwa. Mr. Ndi Ezemgwa has a background in health and social care, apply person-centered approach to learning effectively, resulting in desired outcomes for students with varying abilities. He is a UK-trained assessor and internal verifier of national vocational qualifications. He's a member of the Internal Verifier and Assessors Institute of the United Kingdom. He's a UK-registered Managers Award in Health and Social Care. Stars of Science degree in psychological therapies from Bath and London Medical School, London. He holds a bachelor's degree of medical science plus honors from Punjab University in India. He is an entrepreneur, the founder and chief executive of the Office of Executive Officer of Technical Vocational Education and Training Institute in Gambia called Kiari College, Innocent Kiari Academy. The aim of this institution is to bridge the gap between educational institutions and industry in Africa using the Education for Employment programs. He established Priscilla Davis Limited, an international consulting firm, as well as Agro-Promat Limited, which deals with agricultural equipment, produce, and logistics. He is the founder of a non-governmental organization called Active Support and Care. The goal of this is to cater for people's special needs, especially vulnerable women with mental health challenges. Please join me to welcome Mr. Ndi Ezemgwa to the program.
Thank you very much for the introduction. Because of time, let me stand on the existing protocols, and let me
Mr. Ezemgwa, sorry. Mr. Ezemgwa, sorry to interrupt. We expect that by 10:44, you would have rounded up. I can see that you have very few slides. I'm hopeful that you'll be able to catch up with that. Thank you.
Yes. Yes. Once more, thank you. And I want to appreciate the chairman of the BOT, the chairman of the conference, board members present, my able ES, fellow speakers, and participants. Yes, I'm going to be quite brief and direct in keeping with the principles of PEEF, that is solution focused. Small background. We began this work 24 years ago, taking my piano into a psychiatric hospital in the Gambia. and where people were in some very, very horrible situations. So we're able to establish the first home for women with mental health issues in the Gambia. Then went on to the UK, studied, managed services, and then came back to Africa again. While you were introducing me, you mentioned a whole lot of things. And why it is so is because when we began to work in mental health, we found it very difficult to get funding for our services. We saw the needs because we were on the ground, but we couldn't get the money to support it because of the way African governments see mental health. So we had to grow our own tomatoes. We had to go into some businesses, especially TVET and some other things that raises money for us to run our project. So we do our project, whether we get funding or not, we get to do it. While coming back to Africa 12 years ago, I traveled to Rwanda, Kenya, Uganda, South Africa, Gambia, and Sierra Leone, and did a little bit of survey of the mental health in Africa and how we can serve, because we didn't want to stay overseas for too long. So we've been back for 12 years. And so I will talk briefly our experience in Nigeria since then. A lot of the speakers that have spoken ahead of me have already covered so many things, which I'm sure that those behind me will also say quite a lot. So I will just go to the point. On the first slide, I have the ratio of psychiatrists to the Nigerian population, 1 to 1 million. And of course, we're losing so many with the Japa syndrome. You look at the ratio of mental health beds, 0.4 for 100,000 people, psychiatrists 0.9 and all that. So the challenge is quite enormous. And as the chairman BOT was saying, mental health is something that people don't even talk about. If somebody's bleeding, oh, let us help him. Somebody has diabetes and so on. So, but if somebody is suffering with mental health issues, people don't see any problem helping them so much because they look cold. So there's a perceptions, some of the challenges, is perception of the etiology of mental health challenges in our society. Everybody that asked me, where did you get the juju you are using to deal with these mental health people? How don't they affect you, and so on and so forth? People can understand the reasons for mental health issues. They can understand somebody having diabetes because of lack of insulin, but they can't understand somebody having mental health issues because of some hormones and some neurotransmitters that are not working properly in the brain. So we have quite a lot of that to deal with. We also the quality and quantity of medication administered to patients. One of these, if you notice, when we were talking about me and herbal products, it was because that two of our clients, we have a care home in the Southeast where we keep some of the people that we pick off the streets and work with. When they stabilize, we have a care home where we put them. Two of them I noticed. One is totally blind now, and one is blind on one eye. And I know it's the kind of medication that is being given to Africa. When I was in the UK, I knew also there were issues with medication. There were new generation medication. There were the old ones that had more side effects. But in Africa, I'm sure that what we get here will be the ones that are rejected overseas. So there are quite some side effects, and also the quantity and quality of the medication that they receive. And that is why we are going into research work to try to find out how we can manage mental health issues with our own traditional medication, and how we did it before the white men came. But that's another topic. So the quality and quantity of institutions that train mental health workers. There's paucity of mental health care workers. Even those that are being trained are leaving faster than they even graduate. My college in the UK was Kera College. I trained healthcare workers, community mental health care workers, and other healthcare workers, but we don't seem to have too many of them here in Nigeria. So there's quite a bit of challenge here. So I hope there's somebody that is taking note from the government so that in keeping with PEEF's focus on solutions that we can address this. So I've been on the grassroots for 12 years in Nigeria. So what I'm saying is things I have experienced on the front line, and I will try to give some solutions that can help to improve this situation in Nigeria. So I talk about case studies. These case studies are real they're real things that happen. So these are some of our clients that we have. Some of them with us, some of them we help to go back and start small businesses in their homes and come every 6 weeks for checkups and medication. So I'll just mention a few of the cases here, and that will give you an idea of what happens in the rural areas in Nigeria, in cities in Nigeria, every day. So number one is Aisha. It's not her name. It's a student that has spent 14 years in a university trying to achieve her career goal of being a lawyer. She would have graduated 9 years ago. Now, this young lady, she's 30 years old now, came with her dad to me, and I spoke to them, and we went through a whole lot of discussions. But suffice it to say, roughly here, that she really wants to be a lawyer. She wants to be a lawyer, but the fact is that the assessment method, which is used in universities, is one shoe fits all, which we know is not correct. People should be assessed with different assessment methods, depending on how they have been assessed and on their mental state when they enter into the universities. And I know that overseas, people who are anxious are given some special time to take the exams or take the exams alone. There are some things that you can do, and there are different assessment methods that can be used to get competence, not just by 10 questions, answer 6. And then there's pressure, and people who are fragile and people who are prone to anxiety and mental health issues cannot cope. And that lady, she had a distinction in her high school. But you can see that she was not well managed. So there's a big need for the vice chancellors, for the head of departments of universities to sit down to a proper lecture on mental health. Some of the students we have that are cultists are self-medicating, some of them psychopathic people. So there's a need for this issue to be dealt with. So I'm just using this one quickly to buttress what happens in real situations in our universities and higher institutions and secondary schools as well. So ideally, we should be able to pick these people up from primary school. When I came back newly, I wrote to the former Minister for Health, I think that was Dr. Chukwu, and asked him that we wanted to introduce early diagnosis systems into schools to help to manage this. But as it is now, funding and a whole lot of other factors, so we left it. So if the present government is still ready, that's something that can be explored so that people can be picked up early, so we don't have more of these cultists, we don't have people whose aspirations are dashed along the way. So early diagnosis is important. Management of those who are already in the universities, having counselors, having a team of specialists that can attend to them and help them manage their coursework will be very useful. So that's where I come up with institutional support structures. So there should be a department, active departments that should be able to manage such people. Individual learning plans with bespoke assessment methods. So for people who have special cases, there should be a way that their courses or what they do should be tailored. I'm not saying that they should compromise the principles, but they can compromise the methods. The principle stays the same, but assessment methods to get the results can change to meet the need of the individual. Now I go to case study 2. Mercy, not her real name, lost consciousness on her way to meet her family in Lagos. Someone took her 2-year-old baby during the crisis, and the baby has not been found till date. This happened in 2016. I was running a program for ADB, from some TVET programs for heads of technical colleges across Nigeria. By the way, the TVET was mentioned because we use technical and vocational education as part of our treatment methods, our management methods for people with mental health issues. That's how come we got into TVET. But TVET seems to be more accepted than mental health. So that's why we seem to be more prominent in TVET. So I was running this program, and then I looked from my room. I saw this lady, she was talking to herself, walking past the hotel. And I didn't bother so much. I was back newly. I didn't want to get too much involved. So I just ignored it. Then she went. Then after 2 hours, she came back naked and was asking for water at the gate of the hotel. And they were beating her up. So I couldn't take it anymore. So I came down, and then I told them to stop beating her. And then we gave her some water. Then found an old banner, wrapped the banner around her, and then got a keke and took her to the psychiatric, the medical center in Enugu. I will not want to say here publicly what happened there, but the services were not what's expected. And because I was new back in Nigeria, I was expecting so much, and they wouldn't take her from me. So I took her to somewhere outside the town where they keep people. You know, when they want to clean up the city, there's a place where they just pack people and keep, so that the city doesn't look so bad. And then so I went there. It was on Sunday evening. I managed to bribe the gate man to take her because there was no doctor or nurse. And they chained her, which was very painful. But in the morning I came, and then they removed the chain, and they did whatever I had to do. So I traveled. I went abroad. When I came back, she was now okay to some degree, and I wanted to take her back home. Then she was crying. She cannot go home. I said, why can't you go home? She said that that they will kill her baby. I said, what baby? I didn't see you with a baby. She said that she was living in Lagos with her family. After she had given birth, she was now causing trouble for the neighbors. They lived in this face me, I face you kind of place. Obviously, she must have had a postpartum depression or some issues after childbirth. So she was causing so much trouble. So the husband told her to go back to the village with the baby, which she did. But being in the village after a while, she was missing the husband and the other children, and she risked it and took off to come back to Lagos. When she got to Enugu, she lost consciousness. She was living by the roadside, and somebody had taken the baby from her, saying that they would take care of the baby. So I was furious, and I thought, I was still new, so I had a different idea about these things. So I went to the police. She took me to the police station where she was. They took her to, and then I asked them the questions about the baby, and they said yes, there was an issue about the baby, but the child was taken to the hospital. So I went to the hospital, made some inquiries. Nobody found the baby. I went to the police station, made some noise, and they told me that I should keep quiet. I shouldn't talk too much about it. I should let it go. So I let it go, and up to today, we've never found the baby. So that made me actually want us to focus more on women that are pregnant and women who are nursing, because some people intentionally impregnate them and sell the babies for whatever purpose that they do. So what happens that in the Southeast, where I work mostly, when they see such things, they'll let me know, and we're able to pick the woman before childbirth, make sure that she delivers and the baby is taken to a foster home or an orphanage. Or if a child that already has a baby, we can take them into our care. But that's another long story, which I don't want to get involved in. But the issue that from this particular case study is what do we do? What is happening right now in Nigeria? In the community for people like this. For people that are pregnant with nursing mothers, I've mentioned that they're abused, of course, but the worst is that when the baby is born, the baby is sold. Community support structures. What do we have in the community for people with mental health issues? Of course, we have the churches, we have the imams as well in the north, I guess. But in most of these places, they chain them and they beat them, try to beat the bad spirit out of them, and so on and so forth. So we don't even really have any kind of structure at all. And like I said, to see a psychiatrist is quite a whole lot, and it costs a lot of money. So most of them will have to resort to prayers and some other diabolical ways to manage their mental health. So quantity and quality of carers. Now, carers is something that is very, very, very important to us, and that's why our main company is called Care, K-I-A-R-A. Actually, it's actually carer, someone who cares. One of the things that I provide solution as I'm talking about it is that we need to support carers. Carers with capital C are those family members who are taking care of their relatives, either the husband taking care of the wife taking care of the husband, or the children, and so on and so forth. Those carers need to be supported. They need to understand some things, some basic things about mental health management, some very basic ones. Most times they're out of their depths, and they themselves get exhausted and may eventually have mental health issues because they don't know what to do, they don't know how to deal with it. So we're looking at forming a carer support network that will put them together and give them, continuous support and help do some training for them once in a while. So such things, basic things are required in those rural areas, in communities that can offer some help to some people. Because of time, I'll keep moving on. On case study 3, Funke's mother has mental health issues. When the mother was taken into our care, she was pregnant with...
Hello, Mr. Zengwa. Just to remind you, we have 3 minutes.
Hello?
Just to remind you, we have 3 minutes.
How many more minutes?
3 minutes. 3 minutes.
How many?
3.
Hello? Okay, I'll skip the last case study then. I'll skip the last case study. Then I'll go into the recommendations. I'll go into the slide of the recommendations of the what we think. This model we have is something that we've been able to put together from our work in different countries and back in Nigeria here, and we think that the government can use to help to solve the problem. Now we have on the big ring an assessment team. What I'm proposing is that this is done in each of the LGS, the 774 local government areas. If we have a team like this, that will help to ease the pressure. Now, on the top, you have the secondary and tertiary hospitals where people normally go to, but that shouldn't be the first stop. That should be the last stop. That should be for really serious cases. But we need to be able to manage the situation in the community before it gets so serious that it gets to those tertiary hospitals. So if we have an assessment team that comprises of a range of people and they're trained, they can interact with private hospitals, they can interact with local communities, families, they interact with native healers, doctors, interact with workplaces and so on and so forth. So these people are the frontline people, and that can be called in that local government area. They go do the assessment. And when they do the assessment, and they can be constantly in touch with the community. When they do assessments, then that LGA is supposed to have at least some of these services. Day centers are where some people people with mental health issues, those who are debilitating, can come for the day, spend some time there, do some things, do some arts and craft, and go back home. That's day centers. You have special needs schools. There's those who cannot be integrated into regular schools, can be admitted in such schools and managed. Supported living accommodation, like the one we have in the Southeast, there could be places where people can go to, even if it's temporarily, for the carers to have some break, and for these people to be observed so that we can check their medication, check so many things, and give proper report to the psychiatrist to be able to manage their medication and so on and so forth. Then floating support services. This one is a service which we do ourselves right now. We move from home to home because it's actually best to manage them in their homes than to move them out into places where stigma and so on and so forth. So the assessment team when they pick up, when they interact with the community and pick up, is they can now place them into some of these facilities. Now, when it becomes serious, then they can now be referred to the secondary and tertiary hospitals. So because of time, I cannot go on so much about into it. But if anybody's interested, and of course, if PEEF wants to take this further, I'm happy to volunteer some more information. So I would like Nigerian government to try to implement this concept in each of LGAs, and then we can grow from there. Thank you very much.
Thank you very much, Mr. Ezenwa, for your very enlightening presentation. And the focus, especially case studies as it matters to our local society. That's quite, I know, just like I do have, our audience have their questions and comments. Now it is 11:46 Nigerian time and 10:46 London time. I can guess what it is in the US, correct? So we'll go to the next topic, which is mental health education, enhancing knowledge about mental health issues and coping mechanisms. I'm so sorry, there is a tap running here. We'll be able to stop you now. Thank you so much. And this is going to be presented by Dr. Jamila Musa. She's a pharmacist, public health management. Dr. Jamila is a pharmacist and a public health professional with a strong commitment to improving healthcare systems and promoting community well-being. She holds a Doctor of Pharmacy degree from Gulf Medical University, United Arab Emirates, and a Masters of Public Health from the Nile University of Nigeria. Jamila has worked in various capacities, which include her role in primary healthcare, hospital pharmacy, and health claims management. And in all this, she's demonstrated a commitment to both individual care and systemic healthcare improvement. We are lucky to have Dr. Jamila Musa bring a unique blend of clinical expertise and public health insight to her mission of positive change in healthcare through education, advocacy, and community engagement. You're welcome, Dr. Jamila Musa, as you take the lead.
Thank you so much for that amazing introduction. Good morning, everybody. I'm Jamila Musa, and it's such a pleasure to be here today. So I'm going to be continuing the insightful conversations that have already begun on mental health with the topic of mental health education, enhancing knowledge about mental health issues and coping mechanisms. Next slide, please. Okay, so here's a brief overview of what we'll cover today to explore mental health education and
Sorry, Dr. Jamila. Just to remind you, we expect you to finish by 12:08. Okay.
Okay.
Thank you.
Yeah. Okay. Okay, next, please. Okay, so let's start off with a simple fact. 1 in 4 people would experience mental health challenges in their lifetime. So just imagine this statistic in a group size. It could easily be your colleague, your friend, or even you. And despite this importance, mental health often gets pushed aside. Nearly 70% of people with mental health conditions don't receive treatment. And this is mainly because of stigma and lack of awareness. And that's where education comes into play. So today we're here to change that narrative by learning more about mental health. I'll walk you through what mental health is, the common issues people face, coping mechanisms, and how education can empower us with tools to address these challenges. Together, we're going to explore how we can create a world where mental health is prioritized. Next slide, please. Okay, so to understand mental health, we can start by knowing what health is. but I'm sure you've already heard it in this presentation today. So I'm just going to say it again as a reminder. So according to WHO, it's a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So from the definition alone, we can see that mental health is an integral part of health. And to give a broader visual understanding of it, we can go to the next slide and see this continuum model where we see a spectrum of well-being. And the key idea of this is that improving mental health isn't just about fixing mental illness. Even people without mental illness can still work on feeling better and functioning better in life. Next slide, please. So to tie it all in, we can finally define mental health as a state of well-being where individuals can cope with life stresses, work productively, and contribute effectively to their community. Simply put, it's a state where we realize our potential and handle life's challenges. So for example, just think of someone you know who maybe seems to have it all together, right? They might be having like a complete, they might be managing their mental health well, but that doesn't mean that they don't have challenges. So we all have ups and downs. That's not how we manage them. Imagine mental health as like a foundation of a house. And without that solid base, everything else, our relationships, work, and even physical health is unstable. And this shows you how mental health impacts every aspect of our lives. Next slide, please. Next slide. Okay, so let's look at some of the common mental health conditions, many of which you may actually recognize. So let's start off with depression. Depression is not just feeling sad, it's persistent sadness that makes everything, even like getting out of bed, feel like quite impossible. Just think of it as like a gray cloud that doesn't go away, and it makes everything feel so heavy. This can make a person stop enjoying activities that they used to love. For anxiety, if you've ever had like a time where you couldn't stop worrying, even about like small things, imagine living in that state 24/7 basically. Anxiety goes beyond stress, and it's an overwhelming feeling that can interfere with daily life, like struggling to focus at work or just doing your normal daily activities because of those constant fears. For bipolar disorder, it's like a roller coaster of emotions where you have like high highs and low lows. And for example, someone might feel unstoppable one week and then completely drained the next. And these mood swings are a hallmark of bipolar disorder. For schizophrenia, it's a bit more complex and often misunderstood. It's not just about, hearing voices, but it can actually include distorted thinking and perception. Finally, PTSD, post-traumatic stress disorder, can make someone relive past trauma as if it's happening again, even if they're already in a safe environment. So these common mental illnesses, they aren't just labels, they're real challenges that people face. And just because we don't experience them in our immediate environment, it doesn't mean people don't have them. And understanding them helps us to be more supportive, less judgmental, and it helps us empathize with others and recognize when someone needs support. Next slide, please. Okay, so when it comes to mental health education is enabling people to have control over their health and its determinants, thereby improving their health. And the core elements include awareness and prevention, stigma reduction, coping mechanisms, and resources. Next slide, please. Okay, so why are we here talking about mental health education? Imagine you're sick, right? Maybe you're running a persistent fever, or maybe you have a headache that's not going away. You'll probably seek treatment without hesitation, right? But usually if someone struggles mentally, they might feel ashamed or maybe a bit confused about asking for help. So education changes this narrative. And it does that by reducing stigma. People stop whispering about mental illness and start openly supporting each other. Knowledge breaks down stereotypes, making people feel safe to seek help. It promotes early recognition. If we understand the signs of mental illness, we can intervene before they escalate. For example, you have a friend that normally goes out for social activities and all of a sudden they become withdrawn. You can ask, are you okay? And this might prompt a step in the right direction. It empowers communities. School, workplaces, and neighborhoods can become safe places for mental health discussions. Just remember that education is not just about knowing, it's actually about doing. And it starts with conversations like this that we're having today. Next slide, please. So when it comes to managing mental health, think of it as like building your own survival toolkit. And let's talk about some of those tools that we can use to manage our mental health. Next slide. So self-care and lifestyle choices. Exercise, eating well, sleep, they aren't just luxuries, they are essentials. Even just like a 10-minute walk can lift your mood. We have avoiding substance abuse also. Next slide, please. So for mindfulness, techniques like deep breathing or journaling can help manage stress. These days, there are numerous apps online that are designed specifically for simple breathing exercises that can calm you down. And quickly, if you're able to right now, let's just take a moment to pause and just practice this very simple breathing technique. I'll guide you through a short one, something you can do anytime you feel overwhelmed or stressed or just need to refocus. So how it's going to go is you're going to inhale deeply through your nose for a count of 4. You're going to hold your breath gently for a count of 4 and exhale slowly through your mouth for a count of 4. So I'll just repeat that. You're going to inhale, hold your breath and exhale. And I'll just set a quick timer for 15 seconds. If you're able to do that, you can do that at the start of now. Okay, the timer is up. So thank you. So even just a minute of mindful breathing can actually calm your mind. It can lower your heart rate and help you regain focus. It's such a great tool to carry anywhere you go. Thank you for participating. Now that we're a bit refreshed, let's continue to the next slide. Okay, so for social support, talking to a friend or joining a support group can be incredibly healing. A friend who listens can be more therapeutic than you actually realize. Do not underestimate the power of connection. Next slide, please. You can also seek professional help. Remember that there's no shame in seeking help, just like there's no shame in seeing the doctor for a flu or malaria. Next slide, please. So coping looks different for everyone. So just find what works for you. Just remember that not one size fits all, and your toolkit will look different from mine, and that's perfectly okay. So down to the recommendations. Promoting mental health and addressing mental illness requires action at multiple levels: individual, family, community, and policy, because mental health is influenced by so many factors around us. So let's break this down. At the individual level, the focus is on self-empowerment and resilience. Encourage self-care practices. This includes simple habits mentioned previously, like exercise, eating nutritious food, and getting enough sleep. These can work wonders for stress. Another action for people who are spiritual or religious is to engage in practices like prayer and reflection, which can provide a sense of comfort, purpose, and connection during challenging times. Promotion of mental health literacy is very important also. Imagine if everyone could recognize early signs of mental issues and feel confident about seeking help. That's the power of education at the individual level. So we can move on to the next slide, where we talk about the family level. Families are often the first line of support for many people. Open communication is key. For instance, having regular family check-ins where everyone can talk about their feelings, it can build trust and understanding. Mental health education programs can also help families learn how to recognize signs of distress and provide appropriate support. For family counseling, sometimes family need like professional guidance to navigate challenges together. Then at the community where the changes become visible and impactful, think of hosting mental health talks at your local community center or even organizing a mindfulness day. Peer support groups provide safe spaces to share experiences and partner with organizations and mental resources, ensure everyone has access to these supports. The next slide, please. Okay, so finally, at the policy and social level, we address the largest systems that affect mental health. This includes pushing for affordable mental health services, support in workplaces and schools, and reduced treatment costs to ensure therapy is as accessible as routine doctor appointments. Schools and workplaces can also normalize mental health conversations. They can do that by integrating education into their programs. And at this level, we can also address the social determinants that was also mentioned in a previous topic. Mental health isn't just about what's in your mind, it's also about your environment. Addressing poverty, housing issues, and education disparities, it reduces the risk factors and creates healthier communities overall. By taking action at these levels, we can create a society where mental health support is holistic, accessible, and effective. The key takeaway is this: no matter your role, there's always something you can do to promote mental health well-being, and together we can make this difference. Next slide, please. Okay, so to wrap up, mental health education isn't just a nice idea, it's actually a necessity. And by reducing stigma, equipping ourselves with tools, and creating supportive environments, we can build healthier, more compassionate communities. We should therefore remember to educate yourself and others on mental health, practice coping mechanisms regularly, advocate yourself with available resources, and be a mental health advocate in your daily life. These steps, they ripple outwards and build a society where mental health is treated with care that it actually deserves. And I'll just leave you with this. Imagine if every one of us here took one step to support mental health. The ripple effects could change lives, workplaces, and communities. So together, we can actually create a world where mental health is not just an afterthought, but a shared responsibility. So let's commit to making mental health a priority for ourselves, our loved ones, and our communities. Next slide. Next slide. The final slide. Okay, thank you so much for your time.
We can only say thank you as well, Dr. Jamila Musa. That was very, very wonderful. And your experience and practice in the issues of mental health is well understood. And just like you said, imagine each of us supporting mental health and demystifying the stigma. What's the ripple effect? Thank you so much. And once again, I can actually say that you beat the time. You have gained 6 minutes. That's wonderful. Yes, the next topic would be that of mental health intervention topic integration into existing school secular. But before that, we're going to give the next 15 minutes. So by 12:17, we'll have between 9 and 12:17, we should have finished the next session of question and answers. Please feel free to raise your hand to ask your questions, and we'll be able to ask the presenters to respond, or other people who have ideas in the topic will help us. While people are getting ready, also remember you can drop your questions in the comment and we'll bring it forth. While we're waiting for that, I made some jottings, my comments to the lecture presented by Dr. Agocha. Very wonderful. The part I noted very important is the role of community in mental health. Just like you said, Nigeria no dey carry last. We tend to undermine what we have, the resources we have, the extended family support system. I know how much the difference is. This is someone is interfering. Professor Kerry, can you mute yourself? Please, if you can hear me. Good. Okay. So the role of a community in mental health well-being, very important. The extended family system in Africa, especially in Nigeria that I'm aware of, with diverse religion and culture, how much it helps. This is my 4th year in the mental health services, and I've only spent 4 years in the UK. The other 9 to 10 years was in Nigeria, and I understand the difference, how much help the extended family system rendered to the people suffering with mental health. And in the UK, for instance, a lot is done to make mental health care community-based, so as much as possible get the support of the community, from community mental health services to care homes, to respite homes, residential homes, to nursing homes. The idea mainly is to provide the social support that one would need to cope with mental health, so mental illness. Okay. Still waiting for your questions and comments, but while we're waiting for that, if you raise your hand, we'll call it. Hello.
Dr. Ekachi, I have a couple of questions for all our speakers so far, actually. I have one question for each speaker. I will start with Dr. Funmi. I know you, in your presentation, you briefly touched upon psychological safety. Can you talk a little bit more about that and its importance in terms of, in the context of Nigeria and our workforce? I know in Massachusetts here and other places in the US, that's something that's certainly, touched upon frequently. How do you see the concept of psychological safety, both in the workplace and also, outside of the workplace, make an impact on helping with, mental health initiatives and solutions?
Yes, absolutely. Thank you for that question. So psychological safety is the ability to speak freely and make contribution in the workplace or in families without being punitive, right? And so the critical piece about psychological safety is in 4 dimensions, which is open communication, diversity and inclusion, ability to take risk, and the willingness to help. One of the frames that we're seeing in the workplace is people not having the capacity to share their thoughts or share their innovative ideas because of not having been authorized within the workspace to really speak up. And so as leaders in our communities and in our workplaces, I think it's really critical to create an environment where open dialogue is necessary. And that does not mean that you're not giving critical feedback. It doesn't mean that you're not correcting issues around workplace productivity, but it means that you're giving the opportunity for members of your workspace to have the opportunity to speak up. The other thing is the willingness to help. We see a lot in the workplace where people want to, shine alone. I think that's the word that I like to use, where people want to take all the credit and not create an inclusive environment and include the diversity in the workplace. So really creating a space where, one, there's open communication, there is innovation as a result of risk-taking. Risk-taking only happens when you make mistakes. You don't understand, innovation only happens when you make mistakes. That's one thing that people don't realize. You can be innovative if you're not thinking outside the box. And we see in so many organizations where innovation is, forefront of their work, they're given opportunities for risk-taking. And so really creating opportunities for members of your workspace to really think about new modalities of work and opening the space up for that. One of the questions I like to ask my staff, taking it on a personal level, how can I be of help today? So that is really showing, one, that you're thinking about their thoughts as well as inviting them to seek out help if they need it. So I can go on about this topic because it's one that is really dear to me. So I will stop. I'll pause for now.
No, thank you so much. And I think, you mentioned something very key here, which is, what role do I play in helping to promote psychological safety? And you said something very important, which is, as a leader, taking the step to ask the right questions, or to because if you are dealing with a mental health challenge, issue, or concern, you may not be in the right place to speak up. So somebody may have to speak up and say, how can I help? So thank you for sharing that. Mr. Andy, the next question is for you. Are you still with us?
Yes, I am.
You talked about community support models, and you gave a lot of great examples, case studies of issues that you have personally experienced or engaged in with regards to interacting with individuals with mental health challenges, and also the responses of community. Given the model that you shared with us here, and given the diverse nature of Nigeria and our makeup, what recommendations would you have in order to replicate your model, given our various diverse ethnic groups and communities, and even religion, because we have such a beautifully diverse country. And one model, while we have best success practices, I always say that success practices and best practices are somewhat different, especially given the different dynamics of spaces. Do you have any recommendations on how your model can be implemented across a diverse population?
Yes, the model is the same everywhere.
Sorry, Mr. Ezengwa. Can I request, because of time, that you could answer within 2 minutes? Sorry to say that, yeah.
Yeah, thank you for the question. The model is the same. It doesn't matter the environment that it's in. If you are in an environment where the religion is Christianity, of course, the pastor or the reverend is involved. If you're in a region where it's Muslim, then the imam or those in that area is involved. So, but the key thing here is that we have a paucity of mental health care workers in our society, and we need to find a way that we can manage it. So, if we have a trained team that work in each of the LGAs, and they can go and interact with those frontline people that I mentioned, then they can form a referral team that can manage collectively. At least people have somewhere that they can go to that is scientifically proven, not just taking them to a native doctor where they can be trained and so on. So the model, like I told you before, that we did travel to Rwanda, Kenya, and so on and so forth. So the model was something that we picked up after traveling to these 7 countries, and it can be replicated in every situation, in every community.
Thank you, Andy. That's awesome.
Yes.
So it sounds to me like having a properly trained community intervention team is really important, because that would help to, especially given the different LGAs and different communities, you want to make sure that the folks that are delivering these services are properly trained so that they can take into consideration the different communities that they're working in.
Yes.
Thank you. And lastly, Dr. Jamila, my question for you is, you talked about a couple of things, but based on your presentation, I was curious about social support and empowerment, because that has a huge impact on early intervention, right? I know I have personally seen folks who may have, who have experienced mental health challenges, but due to lack of early intervention and due to lack of social support systems, they have gone down a path that could have been avoided. right? What are some of your thoughts and recommendation on promoting socially early intervention methods, and empowering both the individual who may be dealing with mental health challenges and also the community themselves, in terms of making it easier for people to come out of that shell and say, hey, I may not be feeling well today, or hey, recently I'm experiencing something that's different.
Okay, thank you for the question. So I think it's important for individuals to actually remember that there's no shame in us also be encouraged to check up on one another.
Sorry, Dr. Jamila. 2 minutes still to respond, because we have 2 minutes to the end of this year.
Yeah. Okay. Yeah. So just keep checking up on your loved ones. The people that actually are affected by this should not be afraid to ask for help, should not be ashamed. Once they do help, resources like professional help or mental health, like and to actually promote the education of mental health. And then you can also do your own personal, individual coping mechanisms, reducing stress, triggers. And the important thing is just do not hesitate to ask for help.
Thank you very much, Amila. I appreciate your response here. So, I mean, so really, trying to fight community-wide that stigma, which is what we're talking about today, because that stigmatization is real. And the more we can do to help our communities to destigmatize the community or the issue, the easier it is to be able to help and for people to be able to come forward and ask for help. Thank you for your responses.
Thank you very much, Mr. Ahmed Suleiman, for the questions. They are quite direct to the point, and would have solved some other questions yet to be asked. Can we request for any other questions? You're also able to keep it till the end of it, because we're going to have another session for question and answers. If you're unable to ask it now, we can go forward to the next one. Yes. Feel free to drop your questions in the Q&A comments or in the comment section. We'll be able to pick it and hopefully address them. Without wasting much time, we have to go to the next one. That's the lecture by Dr. James Komolafe. If I'm pronouncing it properly, please, if I did not, forgive me. Mental health interventions, topical integration into existing school curricula. Dr. James Komolafe is the Director General of Institute of Behavioral Alignment of Nigeria. He is a Chief Consultant, Psychometrician at the Cyber Resources. He is a Senior Contributing Professor to School of Policies, Politics, and Governance. He's a brand consultant to organizations, a former banker, an astute administrator, member of several professional bodies as listed. He is a certified cognitive behavioral therapist from Florida, the US. He's a fellow, Leadership Institute, International Institute, member, Behavioral Health, Massachusetts Academy. He builds strategic operational frameworks across organizations, cutting private and public leads. He runs a daily DSTV program on behavioral checks segment, ASO TV, and Walkaway on Wednesdays on Armed Forces Radio, among other behavioral frameworks. Tabloid superintendent over team strategy network. It's a strategic concept, content development through conferences, platform speaking, summits, and the media. Please welcome Dr. James Komolafe to give us his presentation.
Thank you so very much. I count it a real privilege being here today to share the little that I know and I do across the globe in the question and issue of mental health and, of course, the behavioral health. The BOT chair, Baba Buka, the critical leadership of PEEF, my leader and ES, Dr. Musa Rabiu, co-panelist, everyone in the house today. I'd like to thank everyone who have shared before now. What will I say? They've crossed the T's and dotted the I's. But without much ado, mental health. It's high time that it becomes the issue of curriculum development in schools. In fact,
Hello, Dr. James. Can you hear me?
yes, I can hear you.
Hello, Dr. James. Just to remind you, I'm sorry.
Okay.
Expect that by 12:40 you would have been done your
Thank you
presentation.
so very
Yes.
much. I'm aware. So let's do a little aerobics there so that it will not just be talk, talk, and talk. If you can see me, please put your hand here. A little exercise, and to show you the need to make it a curriculum. It is the IDP mantra. You are either observing the IDP mantra or you go to the IDP camp, and it cuts across demography from the cradle to the grave. I say I am intentional. D say I am deliberate. And P means I am present. So we do this everywhere we go, on platforms everywhere, to say, hey, it's high time to check up from the neck up so that we can be good neck down. When we are good neck down, we will be great leg forward. So can you say after me, distinguished ladies and gentlemen, I must check up from the neck up in order to be good neck down. And when I am good neck down, I will be great leg forward. Please celebrate yourself and clap for yourself. That is the slogan. I'm looking for a day when this will become the status quo ante from the crèche to the primary school, secondary school, tertiary institution, because you see, we're talking stigma and stigma. The sense of behavioral health, ignore and ignorance happens to fall into the same psychotic field, for which if we don't shed light from cradle through an organized curricula, then we'll keep talking and talking from generations to generation. That's why mental health intervention program should become topical into the existing school curriculum, as the case may be. Why are we doing this? Want to look at the 5W and 2H model of global competitiveness? Where is the place of mental health intervention? Where does it begin? The topical issue, critical issues around the intervention, and how do we summarize and conclude? On a very pivotal note, integration is critical because it is just right. Beyond the stigmatization and inadequate knowledge, the need for integration and inclusion in the existing school curricula cannot be overemphasized. Oh, charity begins at home. Great. That seems to look like an old cliche now, because we have so many homes that are at dysfunctionality, where parents are physically and financially connected to their wards and kids, but emotionally absent. So they don't know what goes on in the life of their children. So that's why we're saying, hey, look at this. it is not just, mental health is not just about being at the receiving end of mental health violations in the name of bad behavior and all of that. And I get pissed off when I go to the radio or TV, attend the fora, and they say, doctor, can you tell us mental health? And all they are looking and talking about is just the violent behavior, the bad behavior. When are we going to be able to integrate the fact that every day is a behavioral variable in the good, the bad, and the ugly? Curriculum development and integration answers for that. It is also about delivering the end of the positives from the cradle to the grave, where everybody is self-aware, where everybody knows what to do and do what they know, for which the gap is behavior. Very critical. It is also about reversing our upturn triangle, where everybody sits atop ability, peddling reality and creating some certain activity as though in a vicious circle. When are we going to go out of that garbage? Very vital. We can keep engaging and talking until we burn all our oils, but until it becomes a curriculum and our children and grandchildren can learn it. Enough of A for apple, B for ball, C for carrot. As we have English and math cut across every course, so we should have mental health, because every human has that mental side that must be ingrained and pulled out, not in the maladaptive sense of it, but in the original context of it, so that we won't be at just the curative and the intervention end. We can also be at prevent. When you know, I know, all our children know, then it becomes a universal knowledge for us to transact, transmit, and behave very well. So that's what we're saying. A huge lot has to be done to finding out why, what, where, when, who needs it. Everyone is in the saddle. The good, the bad, and the ugly. We're all in the saddle. So simple domestication is critical. That is how stigma will be eroded. That is how we get to expose everybody to this common knowledge. Oh, charity begins at home. That is when the home is in a good order. But in a home that is not in good order, you have disparity as against charity. How many parents are there for their children now? You say, John, are you fine? John says, Dad, I'm okay. But John is in another ecosystem altogether, transacting where he doesn't belong, and you don't know what world is going on. And the parents are bewildered at the vast knowledge of their children, especially in the bad and the ugly. So we have a great work to do. So in domesticating a curriculum, we look at mental health intervention programs in form of 5 thematic areas. 1, the education side of it. It should start from the cradle. This is the teaching and the training aspect from cradle. That the evaluation side of it, simple assessment to engage our children. This is the testing aspect of it. I call it the 5T model of behavior modification. And then, and this is what we do here. We've been able to use this to route so many violations, depressions, and so many other contexts there. Then the third is the intervention programs. It should be domesticated at an early stage. This is the treatment angle of it. It is when we are not able to raise and route some of these maladies that it becomes ganguatuan. I listened carefully to all the previous speakers, and thank God for what Dr. Agota said. It's good to make it community-based and build all of those. But Rome was never built in a day. Before it becomes community, it must begin from the simplest microcosm of the society, which is the family. But the family cannot just take it up until it becomes a curriculum from school where our children will take it home, and then we can recycle that order, and then it grows and takes over the society. Then the fourth area is integration, where we talk about trending the results. So what did you get? How are you feeling? Are you fine? And all of these are still very germane. And then the execution. How do we thrust out the incentive for people to do ongoing learning and continuity? Very vital. The 5T model has worked everywhere. We have engaged people in platforms, in organizations, and all of that. And people see mental health beyond talk. They see the practicality of it and are able to cross their own T's and dot their own I's. So who is involved? Who needs the intervention? And by intervention here, we're not saying we must wait until when the chips are down and we're just at the receiving end of what is bad and ugly. What about the good stuff? I believe that PEEF will raise up a strategic framework and collaborative team to engage government, to say, hey, it's high time. See what Dr. Gocha is doing in America. We can import her. She can jackpada to Nigeria and Africa, and we create this scenario here, and then ensure that our children grow up with this kind of facilities and infrastructure to raise them home, to raise them home. So the individuals, their homes, the religious places will be, quote and unquote, infected with this new strategy of implementation. So very vital. And then the caregivers. If we keep talking about community, hospital, and all of that, can we see the proportion Mr. Andy reeled out? 1 to 1,000 or so, or 100,000. So who will be there to go and do all of those community efforts? That's why if we put it in form of curriculum and call it mental health for the ignoramus, and our children grow up with that psyche, then we have a paradigm shift from the old cliche to the new stuff it is supposed to be. So the knowledgeable are not even knowledgeable now because of what use is knowledge that is not applicable. You are not applying. Beyond what people see on the screen, what do they do? These are the days and in our climb where people know what to do, but they don't do what they know. They tell you na condition make raffish them. And to worsen things, economic principle, apology to Dr. Musarabi, all other things being equal. Doctor, when will all other things be equal? Will they ever be equal? Can't we be ourselves? So we must ingrain some of these things and see what we can do to proliferate knowledge on a systemic note. And that is where framework development that will create the much needed fireworks in mental health becomes very implicit. So very vital. We came up in the Cyber Resources Strategic Hub of a Behavioral Modification Africa, where we will be at the delivery and the deliverable side of mental health. What can I initiate? What are the processes and the procedures of my persona? How do I engage with myself on a critical note to birth incentives for transformation? It's mental health. Mental health is not just when somebody is depressed and how to manage maladaptive behavior. It's also how to reel out the elements of your persona while engaging your potential to create productive activity where your persona, your holistic health, mental, emotional, physical, and of course, spiritual, communes and engages with your potential, which is the element of your strength and soul. Join those two, you begin to create wealth. So, in effect, the new mental health I want to see domiciliated and domesticated across demography is the mental health that identifies the persona of every individual and citizens in terms of holistic health that also engages the potential of the people in terms of holistic strength, the capacity, the capability model, and everything you have for gifts and talents coming to the fore. And when you engage your personality with your potential, it should give us production, which is the wealth. And you know why our people are into corruption and accumulation? Because we have a nature, nurture, and culture that is defective, that has caged everyone to just do what they do. Nobody is living by natural order and consequence. So there's a framework here that must take everybody to the root. And then when we build it, we see new creed without greed. Now, we begin from the individual. 4-dimensional framework. Who does he listen to up north? Who is he leading? Who are his strengths by the side? Very
Dr. J.
Thank you very much, sir. I have
Just to remind you, five minutes here.
Good. Then number 2, how is he able to build a security network around himself to determine his pool? And then who are his lineup? Who are the people feeding from him? And then what safety net is he creating? And how is he being able to build his life from scratch until he becomes his full self? It matters a huge lot. It is through curriculum development we'll be able to have a 3 thematic phase of contact, construct, and contribution, where what goes for one goes for all, in a systemic order of input, throughput, and output. Where this becomes ingrained and it is societal, then we will not have the suicidal tendencies. But where everything goes, nothing really runs, and we're waiting for just the few psychologists and the few psychiatrists. In fact, anywhere I go and you hear mentor, you hear people say, over my dead body, I reject it, not my portion. Why? Because no knowledge, no adequate knowledge. So we must build framework, we must intellectualize from cradle. Skills, competencies, capacity, and all that. And there are reality checks we can run to ensure that this persona and is able to milk out and eke out his potential, and from there begins to create production. When we have this as a curriculum, then everybody will be enthusiastic to want to know more and to turn the searchlight inward for national development, economic development, and the organized private sector can rise. And we can begin to solve our own problems using our own strategy, local content for globally relevant and compliant. Then we can begin to find out individual unique selling proposition for 4. That is where every citizen becomes a power hub, creating the jobs, not waiting for government. So mental health integration into school curricula is the way to go. Otherwise, our government will keep borrowing and putting all our born and unborn children into debt and deficit. So very vital. And then from there, we begin to engage, create institutions out of personalities instead of making individuals as institutions as we have it now. And there's nothing we can do to break that hegemony and protocol until we revisit our mental health issues and all of that. So when we do this domains, then we can have a nation dominating on the out. Very critical. But round up, what must we do? We must salvage the generation from deviant behavior, not by talking and doing surface answering. We must restore a behavioral modification order from scratch that does the 3E model. Exploration. We dig into these children and separate the wheat from the chaff while they are in school, and then we express what we see in them by the virtue of psychometric analysis and other therapies we have here that we engage, and then we establish them in their original default setting, and default mode. So we must salvage our youth through that order. We must manage a society in crisis due to poor mental health integration. We must damage the culture of stigma. And only PEEF can do this. If we really mean it, then we can do it. I want us to know that it is doable. We must start from the scratch to begin to check up from the neck up in order to be good neck down. Sama, when I am good neck up and good neck down, I will be great leg forward. Corruption will be brought to nothing, and everybody will be happy for it, that it belongs to a society that happens. So let's stop waiting for government policies and budget and all of those things until they borrow all of us out as slaves in our own nation and in our own land. So we must go back to this, talk with the president, Ministry of Education to say, hey, we have a better agenda and a better idea to route what is happening now. The organized private sector has what it takes. The education sector has what it takes. It's time to give pivotal curriculum development and inclusion a pride of place so that everybody knows ABC of mental health and become mental without too emotion. I like to stop here for now. Thank you so very much.
Thank you very much, Dr. James Komolafe. That was wonderful. I wish I could stop you from stopping because the lecture is quite emotional without so much emotions. Thank you so much. That's very wonderful. Please, we should be able to go to the next lecture, but can I borrow a leaf from the duo of Dr. James Komolafe and Dr. Jamila Musa to ask that we use the next 5 minutes to exercise our muscles and body, probably use the toilet, and come back at exactly 12:47 to start the next lecture, please. And while we do that, can we ask pharmacist Akinwande Lukman to please be ready to take up once we are back. Thank you so much. 5 minutes, exercise your legs. We have to be neck down to be leg forward. Dr. James.
Thank you, Dr. Good.
Dr. Ayeka, I think you're still sharing the screen. You're still sharing.
Yeah, can you stop sharing your screen?
And maybe perhaps get that that quote from Dr. James.
Okay, sir.
We would love to get that quote so that we can memorize it.
It's a song and a cliche and a slogan. I'll put it on the chat box or everywhere.
Please.
I will donate this song for free.
Thank you.
Hello, Pop. Okay. Yes, it's exactly 12:47 now, and we have to move on. I believe our legs are now forwards. The next topic is towards improving mental health in Nigeria, possible solutions. And hello. Okay. And our presenter is pharmacist Akinwande Lukman, the Chief Executive Officer and the Chairman of Pharmabos Pharmacy, which is located in Ibadan at a place called Jibode, a place I'm very used to, I'm very familiar with. He is a retired director of pharmaceutical services, Oyo State Ministry of Health. Pharmacist Lukman is an administrator of notes and a public health pharmacist. He is the chairman of Oyo State Pharmaceutical Inspection Committee, the Oyo State Patients and Property Medicine Vendors License Committee, both of the Pharmacy Council of Nigeria, Oyo State Drug Abuse Control Committee, NDLEA, Oyo State Task Force on Fake and Unwholesome Drugs, a product of NAFDAC. He is the Southwest Zonal Pharmacist for the National Tuberculosis and Leprosy Control Program. He was a member of the Governing Board of Pharmacy Council of Nigeria between 2015 and 2024. So he was the pioneer acting provost of Oyo State College of Health Sciences and Technology, Ibadan. He's a supply chain pharmacist. He was the logistic pillar lead of Oyo State Emergency Operations Center for the control of COVID-19 pandemic this is a robust fellow, someone who is quite experienced in the field, and he is here to lead us on towards improving mental health in Nigeria, possible solutions. I welcome pharmacist Akiwande Lukman to deliver his lecture. Are you with us? Pharmacist Lukman, can you hear me? Hello. I hope I didn't speak to myself the last 3 minutes. Can someone hear me?
Yes, we can all hear you.
We're hearing you, sir.
Yeah.
We can hear you.
Yeah. Did I speak to myself the last 3 minutes? I was introducing.
We heard you right, sir.
That's okay. Thank you. We're asking for pharmacist Akiwande to pick up the lead. Take the lead, please. Are you with us?
It looks like he might be having some connection issues. I see connecting to audio.
Okay.
Perhaps we
That's
can
all
answer
right.
some questions while we're waiting for him to.
Makes sense? Yes. There are some questions that were dropped on the question and answers section. Maybe I'll mention it, and then if there's anyone that can help us. Okay, you're here. Thank you. Okay, the question is, two of them, I won't read exactly the way, but they are bordering on how can we deal with the problems of stigma in Nigeria? And the next person is asking, why don't we disentangle emotional health from mental health? Since mental health, we know, suffers stigma, can't we talk about emotional health? And also saying that emotional health, if taken care of, may help to prevent mental health. This is the question.
I think we have
My understanding of
Akiwande back.
Can he share his slides? Can you share your slide, pharmacist Lukman?
Looks like he's having some technical difficulties.
Do we go to the next person, maybe?
I think
No, if you can get him to speak, we can present, we can share his slides. If we can get him to speak to it.
Okay. He's still muted. The pharmacist Akiwande, you're still muted. Can we unmute him, or can you unmute yourself?
Maybe we can have Dr. James answer those two questions that you put forward. I think Dr. James talked about stigma a little bit, perhaps while pharmacist Akiwande is trying to sort things out. Dr. James can talk a little bit more about the stigma.
Thank you so very much. The question is very vital. Just like you cannot separate the mind of a man from his body and from his heart, everything is a nexus. Behavioral health captures it all. In fact, the best mentally healthy person is seen in the evidence of his emotional stability. Dr. Fumi will tell you that.
Dr.
So,
Kamala first is maybe that.
no, I was told to answer question. Okay, so very vital. The answer is simple. You can't separate mental health from emotional health. They all work together. When you are good in one, you are bad in the other one, it affects the other. It's a GP tank mentality. Your tank is leaking at the bottom.
Okay, well, can you speak to your presentation if we share it?
Okay, no problem. I'm back. It's back now. It's back on something.
Okay.
You can see me now.
Okay.
We can hear you, but we can.
Hello?
Hello?
We can hear you, pharmacist Lukman. We can hear you, but the background noise is a lot from your side.
Hello?
Hello, can you hear?
Is it clear now?
Yes, we can hear you. Yes. Yes, better.
Good afternoon. Sorry for that break in transmission.
Can you share your slide,
Yes,
or do you
let me
want
appreciate.
Dr. Musa to share?
Hello? Okay, I will do
Hello,
that
yes.
now.
Can you share your slide?
I'll do that one now. Okay. Hello, sir. Can you see it now?
Yes, we can see.
Okay. Good afternoon.
Please, you have 20 minutes to deliver this. So by 1:16, we expect that you would have finished. Okay.
Thank you. Let me start by appreciating the PEEF for this wonderful conference, because the problem of mental health is of global perspective, and presently in Nigeria we are also battling with it. As stated by previous speakers, there are a lot of issues probably hindering the awareness creation for mental health, stigma, and what have you. But before I do that, let me appreciate the BOT chair, Laji Buka Dula, the conference chair, Dr. Bako Edwin, and our powerful ES, Dr. Musa Rabiu, the invited guests, especially my president, newly mint president of PSN, Mrs. Tanko Ayuba Ibrahim, ably represented by his deputy by DPS South, Professor Henry Ohari, other speaker, the chair of this conference, CPC, in fact, other guests, gentlemen of the press, ladies and gentlemen. My own topic is just to discuss the issue on towards improving mental health in Nigeria, possible solution. As I said, I appreciate the PEEF for giving me this opportunity to share my thought and experience on the subject matter. In doing that, I will be looking at this issue from the following outline. We look at the definition, types of mental health disorder, causes of mental health disorder, predisposing factors. We'll be looking at the prevention, treatments, then we look at it towards improving the mental health and possible solution. According to WHO, it says mental health refers to a state of mental well-being that enable one to cope with stress of life, realizes their ability, learn well, and work well, and also contribute to the community development. This definition also includes our emotional, psychological, and social well-being. It also affects how we cope with stress of life, how we handle stress, relate with others, and make healthy choices. Mental health disorder could be caused of various dimensions, various types. We have what we call the clinical depression, which is a disorder of a mood disorder, which is persistent. Also, we may have what we call anxiety disorder, where there's a strong fear, worry, and what have you, that affect the way one does things. A part of the type of mental health is what we call bipolar disorder. This is a kind of mood swing. Somebody is of low spirit now, having a kind of depressive low, and suddenly it becomes manic high. So this is a kind of a bipolar disorder. And also we have what we call dementia, when you have memory impairment, memory loss, and what have you. Also, we have what we call attention deficit or hyperactivity disorder. This is a disorder, is a kind of attention difficulty, hyperactivity that's normally beginning from childhood. And we also have what we call schizophrenia as a kind of mental disorder, the one people call psycho. It is a disorder that affects the ability to walk, think, and feel normally. An example of mental health disorder is also what we call obsessive compulsive disorder, when somebody is just thinking abnormally. Excessive thought, obsession, repetitive thought, which is characterized by reasonable thoughts. And you have what we call post-traumatic stress disorder, which is a disorder that's characterized by a feature of not losing the experience from untoward occurrences. A disorder that characterized by failure to recover after experiencing or witnessing a terrifying event. So these are a kind of example of these are type of mental disorder. What are the causes of these mental disorders? We have child abuse, trauma, and neglect. Please let me quickly rush down because of the later part of the lecture, which I want to stress more. Social isolation or loneliness, experiencing discrimination and stigma, including racism, social disadvantage, poverty or debt. This one, social disadvantages, when you talk in terms of social classification of society, the affluence, the have, the have not. So these are also could generate some mental problem. Bereavement is another causes that could lead to mental health. Severe or long-term stress is also could also cause mental health. When somebody is suffering, he has been exposed to stress over a period of time, so it can also lead to mental health. Having a long-term physical health condition will also be a cause of mental health. And as stated by one of the speakers earlier on, drug and substance abuse, in fact, majorly in our society now, this could be the major, if you rate it in terms of percentage, this will carry the share, a larger share of mental health causes in Nigeria as of today. However, when looking at those causes, they look more of external. But this one, the predisposing factor, this one that is the one I call predisposing factor to mental health disorder. Those are factors that some are inbuilt, some are inherent, like genetic predisposition. If one or two parents of a child of an individual having mental issue, it is likelihood that person may have one sort of a mental problem. Homelessness and unemployment, which is very rampant now, could be also a predisposing factor. Alcohol, as I said earlier on, another drug abuse or drug abuse or misuse is another predisposing factor for drug mental health. Also, discrimination and racial injustice. In fact, of recent, you hear of so many footballers across the world being racially abused. And if they didn't handle it very well, it could give them some sense of mental issue that could be very difficult to handle. Also, family conflict or family disorganization are also a factor, predisposing factor to mental health. And stressful life. With the life we are living now, all of us, we want to make it, or some people want to jump on. All this unnecessary stress we are creating for ourselves could be also a source of a predisposing factor to mental health. And how can we prevent it? Yes, yes, we don't want to have it, the prevention. This may include when you talk to people about your feeling, to some extent, a knowledgeable or a very mature person giving advice can relieve one, can prevent from one getting to mental health level. Getting a good night's sleep, as said by someone earlier on, quality sleep is very essential to prevent mental health. Eating well or eating balanced diet, well diet, also is to prevent mental health. Staying active always. That is, don't live a sedentary life, don't live an isolated life, don't live a lonely life. So if you stay active, interacting with people, sharing your view or thinking or thought with others, can also be can prevent mental health. Then practicing mindfulness, as somebody said earlier on, when you are aware of your immediate environment, what's happening presently, definitely you may not likely have a mental health issue. Then keeping in touch, that's total social interaction. If you keep in touch with others, definitely you won't have to be thinking unnecessarily. That can also lead one to having a kind of mental health. Then stay away from drug and substances abuse is also very key in preventing mental health in Nigeria. Treatment of mental health. Basically, I divided this one into three. The first one is what was a psychological therapy. When you are giving assurance, like somebody that had a withdrawal or trauma, if he or she is adequately counseled or guided, it might come out of, it may not develop mental health. Or the second one is called medication. There are some mental health that require medication, especially this depressive mood, schizophrenia, and all others require medical treatment. Support services can also be of assistance when you are treating mental health. Now, let's look at the cocoa of the matter now. Step toward improving mental health in Nigeria. Evidence suggests that taking the following steps can improve mental health being of an individual. And this includes one, connect with other people. That is when, if you don't live an isolated life, good relationships are important for one's mental well-being. And this can be done by this. It can help one to build a sense of belonging and self-worth. It can also give one an opportunity to share positive experiences with others. And it can also provide emotional support and allow one to support others. Two, by physically active. Being active is not only great for physical health or fitness, it's also good for mental health. So if one is physically active, evidence have also shown that it can improve mental well-being of an individual by one, raising one's self-esteem. It can raise self-esteem. Two, it can help one to set goals or challenges and how to achieve them. Or it can cause chemical changes in one's brain, which can help to promote change one's mood eventually. Three, by learning new skills, people are not there's no age limit to learning. There's no age limit to learning. So by learning new skill, research have shown that learning new skill can improve learning new skill can improve mental health of an individual by boosting self-confidence and raising self-esteem, by helping one to connect with others. When you are learning new things, you are bound to meet new friends, new acquaintances at your learning place. By so doing, one can health, not only physical health, but mental health of that individual can also be improved upon. Number four, act of charity. When you give to others, research suggests that act of giving and kindness improve one mental being by creating positive feeling and sense of worth. When you are giving, when you are giving, definitely it has a positive effect on one's brain, giving one feeling of purpose and self-worth, and it also helps one to connect with other people. Number 5, paying attention to present moment. That is the one we call mindfulness. Paying attention to present moment can improve one's mental well-being, and this includes one's thoughts, one's feeling, and one's behavior, and one around one individual. So people call this awareness mindfulness. That is when you are aware of what is in your immediate surrounding, the happening, and what is going on. Definitely one's mental health status will be improved. It can be positively changed to move to about life and how you approach challenges. 6, as we talked about substance abuse. So to improve mental health, is also necessary that government or spiritual individual across the globe or across the country can establish what we call rehab centers, where the people, the victim of drug abuse and substance abuse, could be treated and rehabilitated, and they will learn 1 or 2 trades for their meaningful integration back into the society. And last possible solution to mental health. 1, because
Pharmacist Lookman.
Hello, sir. Hello.
Hello. Just to remind you, you have 5 minutes to go. 5 minutes more.
Thank you, sir. Thank you. I'm almost done. Possible solutions include getting closer to the nature. By moving closer to the nature, appreciating God, look around and see the creation of God can be a possible solution to mental health issue. Getting more, as we said earlier on, getting more from the sleep is also very, very essential. Keep moving through sporting, gardening, regular cycling, walk. As I said earlier on, physical exercise are way of preventing mental health. So also, and it's also a possible solution to prevent mental health. 4, eating healthy food or diet and stay hydrated. This point need to be emphasized, because if one does not continuously hydrated, the brain function well when there are a lot of fluid around it. So if there's dehydration, it could lead to mental confusion and some other health-related issues. So one need to be eating healthy food and also stay hydrated always. Also, be kind and help create a better world. As I said earlier on, be giving charity. People will appreciate you when you are giving charity. 6, be curious and open-minded to the next experiences. Then planting to look forward to. For example, now if you are a worker, a salary earner, you have to start planning what you'll be looking up to after retirement. That one will give one mental stability. Then also we need to learn to understand and manage our feeling. In conclusion, ladies and gentlemen, usually we need to be continuously checking our mental status by looking at this, what we call mental health checklists. And this includes this question: am I eating regularly? Am I getting enough sleep? Am I feeling okay? What am I feeling? Am I being kind to myself and others? Who can I talk to? So all these things will make one to continuously assessing his or her state of mental status. In conclusion, ladies and gentlemen, I want to appreciate once again the PEEF, the chair, the invited guests, and our CPC chair for giving me this opportunity to be one of the panelists at this 8th conference of PEEF. Thank you and God bless for your listening.
Thank you very much, Pharmacist Akinwande Lookman, for your very enlightening presentation and being spot on. You beat the time. Thank you so much. And with that, I'm going to take us to the next presenter, and appears to I believe that almost all from our workplace, and this is going to be done by a consultant psychiatrist. The topic there is mental health in the workplace in Nigeria. It is going to be presented by Dr. Abdullahi Mustafa, consultant psychiatrist at the NISA Premier Hospital in Abuja. He's also a consultant psychiatrist and head of behavioral and mental health unit, Federal Medical Center, Jabi, Abuja. Pharmacy, Lukman, can you stop sharing your screen, please? Dr. Abdullah, he graduated from Ahmadu Bello University in Zaria in 2009. He did his residency training development psychiatry at Ahmadu Bello University Teaching Hospital, Zaria. He has masters in disaster risk management and development studies, Ahmadu Bello University, Zaria. He is a consultant and head of mental health and behavioral unit, Federal Medical Center, Jabi, Abuja. He is a consultant behavioral medicine, NISA Premier Hospital, Still. He's Assistant Secretary of Medical and Dental Consultants, MDCAN FMC Abuja chapter. Dr. Mustafa is a lecturer at the Department of Internal Medicine Psychiatric Units at the Biz University of Abuja. Dr. Abdullahi Mustafa, you are welcome to this program. And please, can you share your slide and present topic?
Okay, good afternoon, our able moderator, Dr. Ekachi.
Thank
my
you,
co-panelists, and the organizers of this wonderful program. I'm here this evening to be talking about mental health in the workplace.
Dr. Mustafa, are you sharing your slide? I was seeing your screen.
Yes, I am.
Yeah, okay, wait. Okay. I'm just trying to remind you, haven't shared it yet.
Yeah. Okay, so I'll be discussing under the following outline: introduction, definition, and history of psychiatry.
We're not seeing your. We're not seeing your slide yet. I don't know if I'm the only one. We're not seeing your slides yet. We're just seeing your desktop.
I think we can only see the screen, not the slide.
Yeah, we're only seeing your desktop screen. We're not. You have not opened the slide. You're not sharing it.
Okay, Dr. Mustafa, we can share your presentation from here while you speak to it. So if you just stop sharing, I can share from here. Is that okay?
Okay, let me stop sharing.
And also, please adjust your screen so that we can see your face. Yeah, you are not showing your face properly. So you can stop sharing. I will share your presentation from here.
Yes. Okay.
Okay, Dr. Mustafa.
Can go on now, Dr. Mustafa.
Okay. Okay. So, can we go to the first slide? next slide. Okay, so we're going to be discussing under the following outline. Next slide. Next slide. Okay, so by way of introduction, we usually neglect our mental health, but just like our physical health, our mental health is crucial for our overall well-being. In fact, so in as much as our physical health, our mental health is also necessary for our overall well-being. And our mental health has been observed to enable us function as and thrive as individuals, family members, and community participants. As we are all aware, this year's World Mental Health Day focused on mental health in the workplace, because most times it's easy for you to take excuses or to be given a sick leave for mental illnesses. But the directors and the HRs will hardly ever give you a sick leave if you tell them you're feeling low or you are unavailable to come because you are going through some mental health struggles. So I think it's time for us to now start focusing on our workplace and mental health and vice versa. Next slide. Yeah, the World Mental Health Report in 2022 focused on transforming mental health for all. They identified the workplace as an example of a place where transformative action on mental health is needed. As we all observe, for those that for the working class group, mental health.
Dr. Mustafa, I don't know if I'm the only one, but your voice keeps disappearing.
Work and mental health okay. Work and mental health are closely intertwined and they are closely related. A safe and healthy working environment supports our mental health, and a good mental health enables us to work productively. Whereas a poor mental health can interfere with our productivity, and also workplace stress also predispose, precipitate, or perpetuate mental illnesses. Next slide. Next slide. Yeah, these are some of the characteristics of mental well-being. Include feeling good about yourself, lasting and satisfying interpersonal relationships, feeling comfortable with others. You do not become easily angered or overwhelmed. You can laugh at themselves and others. They can meet life demands and handle their problems when they arise. These are all characteristics of a good mental well-being. Next slide. So let's now go to definition of some of the concepts that we're going to be using during this presentation. WHO defined mental health as a state of well-being that enables us to cope with the stresses of life, realize our own abilities, be able to work well and learn well, and contribute to our various communities. Maybe we should look at it again. The ability for us to be able to cope with the daily stresses of life, realize our own abilities, learn well and work well, and contribute to our various communities. Other definitions include mental disorders, psychosocial disabilities. Next slide. They've all been extensively talked about by the previous speakers. Next slide. Next slide. Okay, psychosocial disability. Can we go to the previous slide, please? Yeah, it's a disability that arises when people with long-term mental impairment interact with the various barriers that may hinder their full and effective participation in society on an equal basis with others. Example, discrimination, stigma, stereotyping, and exclusion. Next slide. Work is any activity that is performed by any persons of age and of any sex to produce goods and services for use by others or for their own use. A workplace is defined as a place people go to earn a living. It will also be termed as a place where people perform tasks or job for their employee that is paid for or that earns you a profit. Unemployment is people of working age not in employment or looking for employment and are available for employment. Next slide. Stress is defined as a state of mental or emotional strain resulting from adverse or demanding circumstances. Whereas bullying is when a person intentionally uses words or actions against a group of people to cause distress and risk to their well-being. Mobbing is synonym or similar to bullying, but specific to bullying within the workplace, where the victim is targeted by a group of people. Bullying and mobbing are risk factors to mental health disorders in the workplace. Next slide. Now let's look at the history of psychiatry in Nigeria. We had the traditional phase, also known as the pre-colonial era. That was before 1903, where we have the transitional phase. That was the origin of the beginning of the asylums. The first asylum in Nigeria was the Calabar Asylum in 1903. This was followed by the Yaba Asylum, then the Lantoro Asylum in 1944. These have all been converted to psychiatric facilities, standalone psychiatric facilities. Then the era of the therapeutic phase, which started from 1954 to date. It came as a result of the advent of medications, antipsychotics, antidepressants. Yeah, so we have the Arrow Village System, psychiatric hospitals, the psychiatric departments in teaching hospitals, general hospitals and federal medical centers, community psychiatric centers, or community care or specialized care, then integration of psychiatric care into primary healthcare system. So this is like an organization of the psychiatric services in Nigeria currently. Next slide.
Dr. Mustafa.
Yeah.
Let me just keep leading you. You have 8 minutes more.
Okay. So this is the state of mental health in Nigeria. We have 8 federal neuro psychiatric institutions and all. Next slide. Like 1 in 10 people in Nigeria suffer from mental health challenges. In Nigeria, we have 1 psychiatrist in Nigeria to care for 1 million people. And I'm sure it's currently reducing because of the Diakwa syndrome. Mental health services are unevenly distributed. There are more psychiatrists in the urban areas, whereas there are more psychiatric disorders in the rural areas. The 4% of national budget is allocated to health, whereby 3.3% of the budget allocated to health has been allocated to mental health. Next slide. Next slide. Next slide. This has all been discussed. This is the epidemiology of mental disorders, especially in the workplace. It's self-explanatory. Can we move to the next slide? Common mental health disorders in the workplace: anxiety, OCD, stress, depression, schizophrenia, eating disorders. Next slide. Next slide. Next slide. Next slide. Presenteeism, irritability, restlessness, procrastinating are all signs of mental health disorders in the workplace. Next slide. Let's go to management. Time is not on our side. Yeah. Next slide. It's an example of a man having a panic attack at the workplace. So this impact mental health issues at workplace. It's just a summary. Absenteeism, where employees who are dealing with mental health issues, they are more likely to be away from work. So when you notice that one of your staffs are taking frequent excuses, absent from work, you should know that there's a mental health disturbance. Presenteeism, accident and errors, and reduced productivity. These are all impact of mental health issues at work. Next slide. Yeah, continuation of the effect of poor mental health in the workplace, decreased or lost productivity and turnover, human rights violation, loss of job, absenteeism and presenteeism, stigma, which is negative attribute, beliefs, and stereotypes towards people with mental illnesses. Workplace violence, usually perpetrated by people that have mental health disorders. Next slide. This is an example of a work-life balance. A man meditating in the office. Next slide. The benefits of making workplace mental health a priority. The benefits include the workplace is a means of livelihood, increasing sense of confidence and purpose, and an opportunity for positive relationships and inclusion in the community. For people that are suffering from mental health disturbances, a decent work can help them recover, improve their confidence, improve their inclusions and social functioning. Next slide. So these are all benefits of workplace mental health. So we need to make workplace mental health a priority. The benefits is to the household, to the employers, and to the society. For the society, benefit includes savings in healthcare expenditure and welfare support. There are also reductions in rates of premature death, disabilities. There's increased productivity at work. Next slide. Yeah, this is a pictorial representation of how to support, how to maintain optimal mental health in the workplace. First of all, we need to prevent mental health disorders by reshaping our work environment. Reshaping our work environment and minimizing psychosocial risks. The key intervention is psychosocial risk management and organizational interventions. Secondly, we need to protect and promote. For those already at risk, we have to strengthen awareness, build skills, capacity building, and we have to also provide opportunities to recognize and act early on mental health issues, so in order to protect and promote mental health of our workers. The interventions in the second stage include periodic employee-assisted programs, whereby you check the mental health status of your workers periodically through by way of questionnaires, focus group discussions, and all that. Then the third way is to support people that are already suffering from mental health disorders by giving them access to continue working. As we all know, mental health disorders is a stigma for us here. We either refuse to employ them, or when people find out they have mental health disturbances, they are disengaged from their workplace. Next slide. Next slide. Next slide. I've discussed all this.
You have 2
Okay.
minutes to go, Dr. Mustafa. You have 2 minutes.
Okay, I'm rounding up. We're on improving mental health at the workplace. So the activities are directed towards the workers and their representatives, which involves identifying the various hazards, the various factors that prove the act as psychosocial hazards at the workplace. And we also need to be informed and trained about the measures that need to be adopted to prevent these associated risks. We would like to deploy multi-sectoral and multidisciplinary approach involving every members of staff, like the admin staff, the HODs, psychologists, mental health physicians, which involves continuous advocacy on promotion and prevention of mental health disorders. Here we need to address all the challenges that facing mental health in Nigeria, like brain drain, lack of political will, social stigma, myths and legends surrounding mental illnesses. Our mental health laws are currently outdated, although a bill has recently been passed, but has not been assented. Then we need to also identify early and manage mental illnesses. We need to build capacity to train and equip our workplace with mental health specialists. At least every big office or parastatal should have at least a counselor or a mental health person that attends to issues concerning mental illnesses in our office clinics. Next slide. Then by way of policy, we have to adjust our working hours. Like those people that work from home, they need to create boundaries. You know, working from home does not mean that you have to work 24 hours, which is not good for your mental health. Then we need to also encourage staff to have an open conversations about their mental state. They should be able to talk to their superiors, look at the appropriate time, you know, and have a discussion. We should also learn to have intermittent breaks, provide provision of recreational areas within the workplace. Then there should be room for interpersonal relationships where they talk about their personal issues, create that environment. Then there should an improved reward system, like best staff of the night, best staff of the month, award nights, end of year parties. All this will go a long way in improving our mental health. And by way of conclusion, next slide. There's no, next slide. We need to understand that mental health is a vital aspect of our overall well-being and should not be overlooked or stigmatized. All workers have a right to a safe and healthy workspace. Together we can, as our mental health is our collective effort. And we should also remember that there's no health without mental health. And all hands must be on deck to ensure that we have a healthy working environment. Lastly, we must work collectively towards creating a safe environment for mental health to be openly discussed. And those struggling should be given as support, and we should continue to educate ourselves to reduce the stigma surrounding mental illnesses. And also to remember not to be judgmental. Thank you very much. Thank you for listening.
Thank you very much, Dr. Mustafa. Thank you for that. Thank you so much. That's wonderful. At this point, question that would so we're able to today was trying to do justice a role for emotional intelligence in our mental health. So it is actually very difficult to divide it. And I believe that if we push for this to be disentangled, because mental health receives stigmatization, that's also a way of further stigmatizing mental health by removing it. I think the idea should be for us to talk more about this mental health and drive it home, just like someone says somewhere, in a locally acceptable, culturally acceptable, and religiously acceptable ways of disseminating information. Someone also talked about how can we deal with problems of stigma in Nigeria? Yes, I'm just saying this, dealing with problems of stigma, just like someone dropped on the chat box that women don't know that they have mental health problems. And the question I'm asking is there a role for stigma here? Is it that they don't know or they don't accept they have mental illness? These are two different things. And in stigmatization, the worst part is self-stigma. When people stigmatize themselves, and that goes to institutional and public stigma. So we can start dealing with it from dealing with self-stigmatization. Dr. James, I will allow you see if there are some things you could say about these two questions or issues raised before we go ahead. Okay.
Thank you. Thank you very much, sir. Trying to separate between mental health and emotional reality is like trying to separate water from being gaseous to liquid or some other means. At the height of your mental wholeness is your emotional stability. Life is all about energy, either active or inactive. Energy of the heart, energy of the mind, energy of relationship, either vertical or horizontal. Just as we take in oxygen to breathe out carbon dioxide, in the same vein, we build energy on 4 coordinates: mental, energy of the mind; physical, energy of the body; emotional, that is the social energy, energy of critical connection. And that could also be vertical or horizontal. So actually, energy is emotion. Energy is emotion. When your energy is mental and emotional, mental and that of the heart, which could be spiritual or intuitional, are within you, those are energies within you. But when you begin to use them as a basis of communication, interaction, and interface, in order to create the much needed intervention, it becomes emotional energy. So you can't really separate the two. They are intertwined and juxtaposed. The height of one will determine the stability of another. When I'm emotionally unstable, it goes into my brain. So the way I feel, think, and reason happens a huge lot to affect the state of our mental wholeness. And in cognitive behavioral therapy, it says the way a man thinks affects his feeling, that goes ahead to determine the direction of his passion and the action to which he puts forth. So when your emotion is stable, it's because you are mentally healthy. When your emotion is unstable, check your mental health down in the drain. So we can't really separate. It's like saying the GP tank is leaking at the bottom and then by the side. It's still the GP tank leaking. Just like you cannot separate between your mind and your body, although by function and by concept, they differ, but there's that tight closeness that what affects one affects the other. So no separation. Thank you, sir.
Thank
and
you.
then to stigma.
Thank you so much.
Stigma is caused by 2 things, for which, like I proposed, mental health integration curriculum development will wipe off. Ignore and ignorance is the bane causing stigma everywhere across continental waters. What is ignore? You know what to do, but covertly or overtly, you fail to do it. Ignorance, you don't know, so you don't do. Both of them affect the same consequences. So it is better we create a level playing field where everybody knows, like I said, from cradle to the grave. You are in the light, I am in the light, everybody is in the light. So nothing to hide. But by the time a critical mass is not in the light, the few that are in the light can be stigmatized. And then there's a lopsidedness there. So where everywhere is lighted up through a knowledge-based systemic curriculum inclusion, then we all come to the know. And when we know the truth has a way of setting us free, plus including stigma.
Thank you so much, Dr. James. Dr. James, can I quickly read what someone has written here? It says,
yes, sir.
Dr. Komolafe's vibe and energy delivers awesome positivity. Listening to him is actually good for mental health. Dr. Komolafe, I can say that my depression has been cured by listening to
wow.
you. And I believe that
on DSTV.
Yeah, okay, that's very important, and I'm letting our listeners know that Dr. Komolafe is usually on DSTV, but you may make yourself more available and travel across Nigeria and give this positivity. A lot of people don't have money to pay for DSTV in Nigeria.
Okay, on the phone.
Thank you so much.
Thank you very much.
Thank you so much. Thank you so much. Yes. While we wait for more questions, I want to raise some issues or some critical. There are no questions I don't expect an answer, but it's something for us to think about. If I will take them one after the other, depending on the lectures. I want to say here that the definitions of types of mental illnesses are not as simple as may have been presented in this program. But important thing is that we are becoming more aware. And with this, I want to say that everything is a stressor or predisposing factor to mental illness. And when I say everything, it doesn't have to be negative to be a predisposing factor. It could be a positive thing. Remember, there is a information or good news could be a stressor. I give you an example. Change of status from being single to being married, becoming a parent. These are good information or good achievement, but they could be stressors in our lives. Let's know that it doesn't have to be entirely negative to be stressors or predisposing factors to mental illness. Two types of mental illness I noted while Pharmacist Lukman was delivering his lecture. PTSD, and PTSD means post-traumatic stress disorder, and OCD means obsessive compulsive disorder. For PTSD, I just want to ask all of us here. I'm aware that a lot of people who have influence in Nigeria are here, or they may eventually have access to our program today and the lectures. And I want to ask, how is Nigeria prepared to deal with the possible increase in incidence or prevalence of PTSD in the country, considering the number of traumatic events that have happened in the country in a few years back and still happening? Then the issues of hunger and difficult economic situation in the country. How is the country prepared? How can PEEF help drive this information to the awareness of the people who run the country? Yes, someone also mentioned that a lot of times when someone says, tries to discuss his mental health challenges, The person could be stigmatized. Yes, in our society, people are not allowed to discuss how they feel. Is a problem. And remember, there's a condition called somatization or somatoform disorders, where the mind unconsciously converts psychological symptoms to physical symptoms that could be accepted. For instance, when I was growing up as a young man, if I told my mother that my girlfriend has broken my heart, the next thing you will hear either from her or from the other people, my family members or friends, is to tell me to wake up, I should stop being silly. But that's the reality on ground. That's how I'm feeling. Nobody wants to listen. They will tell you there are so many fishes in the ocean. Buckle up, men. Let's move on. The only time they will pay attention to my concerns is when my mind has unconsciously converted these psychological symptoms, maybe to pains in my head, pains in my chest or waist, and I will get the same attention I would have gotten if they had listened to me. So these are issues. Treatment of mental illnesses could range from medical, psychological to social, or maybe a combination of these things. But I want to say here that the first step to making a diagnosis of mental illness will be a prompt and appropriate diagnosis. Someone has said, Dr. Mustafa mentioned how mental health services are unevenly distributed in the country, where you have more mental health facilities in the city compared to the hinterlands and villages. Unfortunately, despite the fact that you have recorded more mental health problems in the communities than the cities. So we need to see how this could be done. There has been effort to integrate mental health service to community primary health care. How far have we gone? How far do we need to go? How effective have they become? Yes. When my brother, Mr. Ezemwa was speaking, he mentioned maybe I got it wrong, or maybe I didn't get it clearly. Some of the people they have in care homes in the South is one of them being blind and possibly linked to query, quote unquote, fake medications coming into the country. Well, my understanding of the medications that we use in mental health services in Nigeria is that a lot of them we still use, and we still use a lot of the third generation medications. Why do I say this? In a lot of other developed countries like the UK and maybe America, there is a room for insurance being able to take care of mental health illnesses and treatment. To the best of my knowledge, the last time I checked, I don't think mental illness has been included in the National Insurance Health Scheme of Nigeria. I don't think so. Maybe I'm wrong. But with that, is to understand that most people pay out of pocket, and out-of-pocket expenses is not easy when you have to treat a chronic condition like mental illnesses. So it will be very difficult for someone to be prescribed medications they wouldn't afford. So these medications, old generation or first generation medications, especially in psychosis, tend to have a lot of side effects. Fortunately, unfortunately, blindness is not a very common side effect. I'm trying to say that we'll have to be very careful. We need research to see if there are other factors that may have led to this blindness and not just medication. Postpartum mental illness. I want to call our attention to how common it is in our environment and how traditional and religious through cultural practices have colored the situation and how these women have been victimized and maltreated because of having a diagnosis that would have happened to someone else just by virtue of the fact that it happened either during pregnancy, during childbirth, after childbirth. So it is something quite common, and we have faced it so many ways, and I really pity the women. What can you do if we don't change the issues back home? It takes us back to what Dr. James has said, that the family is the primary focus to mental health awareness, but it would not be possible to have this if we don't have our children learn it and take it back home. So back to the school curriculum. Training
Okay,
of our patients
okay.
mentioned in one of
Dr.
the centers.
Hegachi, sorry I'm interrupting you. You know, we're well above time.
Yeah.
So we need to stop at 2.
Yeah, I
Yeah,
understand.
yeah.
I understand that yes, I want to take us this because it's very important. Nobody has actually mentioned it. Remember, this thing is related to the new Mental Health Act, and training of our patients has been discussed in the new Mental Health Act, and the rights of patients who have mental illnesses. This is very important that we understand that facilities that are supposed to treat or handle mental health conditions should have the approval. And again, let us see how this could be implemented and moved forward. Thank you very much, Dr. Musa. Good. I don't know if we go,
Okay.
if we have more questions or what next we
Yeah,
need to do.
two persons have raised their hands. Dr. Edwin Bako, our conference chair, and Ahmed Mohammed.
I will let Dr. Bako go. I think I saw his hand raised first. So Dr. Edwin Bako, please go ahead.
Thank you, Mr. Ahmed. I just wanted to quickly make just a short contribution on the issue of stigma. We have a long way, a very, very long way to go with stigma. And in order to be able to destigmatize it, it will need a number of approaches. One of the very first things that we need to do, and I think that had been mentioned by Komola Fair, Jamila, and also for me, has to do with integrating mental health with our education system, the curriculum, stretching from the primary level to the tertiary level. It has to be a continuous thing to be able to get out of the minds of our people. And our facilitator did mention something about us being the stigma, that is the individual also being the stigma. So these are some of the problems we have and need to tackle. Conferences such as this, workshops and seminars are other ways in which the awareness and advocacy can be moved forward. And then the use of social media campaigns and collaboration with influencers on the social media and outside of social media are some of the ways in which we can reduce stigma in our society on mental health. Just by way of mention. Thank you very much.
Thank you. I know we are working against time, so I'll make it quick. I just wanted to highlight two things here. I think number one, that you know, in the conversation today, I know we are working against time, and this is by no means a space where we will solve the issue of mental health programming and initiatives. However, it's a contribution to the conversation. So I think for anyone who wants to continue this conversation, we certainly invite you to join PEEF through the PEEF WhatsApp platform. There are lots of great conversations that are happening on a daily basis. If you want to partner with PEEF, collaborate with PEEF, make contributions towards policies, joining PEEF is a great way to do that and to continue to push the conversation forward. One of the key topics I think that definitely should be discussed or continue to be discussed is the role of counseling in addressing mental health conditions and how it contributes to the overall treatment and recovery of mental health. And I think that's certainly a significant area in terms of early intervention. That's one thing that I think it contributes to the stigma of people not being able to reach out for help. And we have professionals who can have these conversations. I know we have a number of folks here. For instance, we have Dr. Mustafa here and others in this field that are able, that offer these types of services. So I think the encouragement of people to do that. Another thing is to add to what Dr. Onyekachi mentioned earlier, knowledge is power. The changes made to the mental health legislation through the National Mental Health Act of 2021 that was released January 2023. I think it's really important for people to educate themselves and to make themselves aware of the significant changes from the pre-colonial version of the act. I've gone through it myself. There's a significant difference, and I think it's important for community leaders, community partners, service providers to be able to look at this, because they are the ones that are going to be at the forefront of pushing for these changes to actually happen. A lot of the folks that are dealing with mental health issues, conditions, don't necessarily have access to these information or even knowledge that some of these new changes have occurred. So I think even advocacy in informing people about this new development in terms of what's available to them is going to be really important. So whatever we can do, definitely, I think it's a way to promote that. But once again, I'm going to make one more plug about joining PEEF and also making sure that you join the WhatsApp group platforms to continue this conversation. Thank you.
Very
Thank
much,
you.
Mr. Ahmed. We are quite behind time now, 2 minutes past 2 p.m. and we're supposed to have finished at 1:45. We still have conference highlights and vote of thanks. Dr. Musa, can you help us with them? Is Mrs. Miriam Ladi Troman here, please?
Yes, she is.
Okay, please. She is the coordinator, Yusuf Omar Bauchi, Saminu Sakin.
Let me just check. Does the chairman BOT wanting to make a comment also before we go to the next?
No, please go to the next topic.
Okay.
Thank
All
you.
right. Okay. Mrs. Truman, are you ready and your team?
Can we have 5 minutes, sir? In the next 5 minutes, we'll be available.
Yeah.
Okay.
Hello.
Yes, we can hear you.
Yeah. Good afternoon, everyone. Please, can you give us the next 5 minutes? We'll be back.
Sure.
Right.
We have, I know we're running out of time, so certainly whatever you can do to make it happen quicker would be appreciated.
Oh, thank you.
Can I ask Dr. Bako how he thinks we can get this to the Minister of Health or the other Minister of Health across the, look at the roadmaps for implementing the new law?
Dr. Bako, are you there? He may not.
But Ahmed, you can step in and answer, respond to the chairman BOT.
I'm willing to listen to anybody with any
Yeah,
suggestion.
I'm saying Ahmed because I know he may be able to do something.
Well, I think there are a number of ways that this can happen. Obviously we talked about advocacy, we talked about collaborations. I think even in this particular conference, there were a couple of few people that indicated interest in already existing efforts that are happening. So a lot of people have connections to individuals. I know even in the PEEF platform itself, who are experts, but who are also connected to people in industry, in ministries and industries that are tied to that can be influential in helping to promote this. So I think one of the things that we can do is partner with folks that are within the PEEF organization and also other organizations to reach out to, the Ministry of Health, for instance, to present, findings in order to help push this out in communities. I think community efforts, perhaps even taking this new legislation, this new act, and educating, providing town hall education formats. How do we get people to learn more about these new changes? Because many times we're talking about family members who are guardians, so to speak, for those who are obviously experiencing extreme cases. But there are many of us, as we have heard here today, mental health conditions are not narrowed to only folks that are experiencing the extreme cases, but we have mental health conditions such as depression, anxiety, panic, all kinds of variety of conditions that people experience, both from the different communities. So I think it's important to really tap people from these different communities and through conversations, create material that can be submitted upwards into areas of influence, such as ministries of health and others. So that's just my 2 cents. I don't know if others have anything to add.
Can I contribute something,
Of course.
Mr. Ahmed? Well, I'm happy you've read the act. Yeah, we're happy that it has its own very good parts, especially as it pertains to protecting the rights and privileges of people suffering with mental health. At the same time, if you look at the part 5 of this act, I'm quite worried. There are loopholes considering the peculiarities of the country, how this could be hijacked and used against people who have mental health problems for political reasons, especially understanding what's happening in our judicial sector and how that appears, quote unquote, not to have some independence. Because if you look at that part, it talks about how to dispose the property of people who have mental health problems. I think we should start with putting loopholes on this section of this Mental Health Act and start amending it instantly because of what it portends. I'm more interested in not only the good part of this act, it also has its own faults. So that's for those who have the ears of the government and who are policymakers and changers of things. This is something to be worried about.
Absolutely, I agree with you on this one. I think it's a significant step forward and a call to action, but it's certainly by no means a final product. I think it's an opportunity for folks to use this new act to kind of explore ways to make sure that there are no loopholes, as you've mentioned, or areas where people can be taken advantage of. Wow, now I really feel like I'm.
Thank you very much. Thank you very much. That was good. That is very enlightening.
We have a nice little background here. It makes us seem as though we're in a panel.
Or classroom where Dr. Musa,
nice.
Dr. Musa is the lecturer.
I like it. I like it.
All the students enjoy him.
Somebody has hands raised up. Jamila, you?
This is called necking up and not legging down.
Yeah. Somebody has their hand raised.
I think it's Pharmacist Akinwade.
Okay.
Jamila, is that correct?
I think it's Pharmacist Akinwade.
Okay. Yeah.
Is Ms. Mariam ready? I think we're about 5 minutes or a little bit more at this point. Ms. Mariam, are you ready?
Good afternoon, ladies and gentlemen.
Good afternoon.
I stand on the existing protocol and want to appreciate the organizers of the program and the honor given to me to be the organizing rapporteur. This is a very sensitive topic for me as a woman and a northerner, and it's really, the speakers have done a very good work. It's almost impossible to be able to give a brief report because everything they said is important. Everything they said is key to our survival and getting a solution to mental health issues. Being a woman, being a mother, I have come across a lot of that. And so I pray that I will be able to make justice to the brief report that we have while we work towards giving a comprehensive report to the ES by the weekend. So looking at what we have here, the presentation by Dr. Fumi, it's talking about the key points there, the challenge and issues are stress and burnout. And the recommendation we got there is enhancing protective factors, launching promotion and preventive programs to reduce the occurrence of mental disorder and reduce pervasive stigma. The second key issue we picked was organizational culture, building skills and resources is the recommendation, whereby we develop sustainable public health system and expansions to enhance access to evidence-based mental health treatment. The third key issue is the work-life balance. The recommendation is creating supportive environment, mental health system treatment and research capacity is the recommendation. The fourth key issue we picked from Dr. Fumi is stigma and discrimination. And the recommendation is reducing stigma, clear and urgent need for comprehensive mental health policies. And fifthly, and not remote work implication, and the recommendation there is an issue of primary and secondary prevention. The second speaker is Mr. Ezenwa, and the key issues we picked there is, sorry, inadequate mental health services. And recommendation is management of students with mental health challenges in our educational institutions. Early diagnosis, institutional support structures, individual learning plans with bespoke assessment method. The second key issue we picked is prescriptions of entrology of mental health challenges in our society. And the recommendation is management of people with mental health issues in our community. Focus on pregnant and nursing mothers with mental health issues, community support structures, and quality and quantity of carers. And then the management of children with mental health issues in our community, early diagnosis. Now, the next speaker was Dr. Musa, and her emphasis also is on the issue of support to reach out, and all of us, all of us experience it, and then one time or the other in our life, and mental health and physical health is inseparable. Stigma, the issue of stigma is what we picked there is the issue of shame and fear, and the next key issue is access to care, and then there are barriers because of the stigma, and then workplace excessive pressure, and the recommendation is also the issue of technology. We isolate and then find solutions. We should prioritize mental health conversation is the recommendation. The next speaker is sorry, I'm still here. Hello.
Yes, Mrs. Truman, we can hear your voice.
Okay.
Please continue.
Okay. Sorry, my document is getting juggled with the internet. Then sorry, we have Mr. Pharmacist Akinwade, and the key issue picked there is issue of policy advocacy and public awareness, which the recommendation was addressing stigma, which should be the central focus. Then capacity building, The recommendation is he called for enhanced training of healthcare professionals to recognize and treat mental health conditions effectively. The fourth key issue is a collaboration with NGOs. And the recommendation is that the non-governmental organizations be encouraged to have a stronger partnerships with government to leverage resources and expertise mental health intervention. And he also talked about youth-centric programs, and which he said is it cannot be overemphasized considering the use of drugs and the issue of unemployment, academic pressures, and societal problems. The fifth key issue we picked there is on the strategies for reducing stigma in rural communities, and he recommended best practices in workplaces for mental health programs, and then opportunities for public-private sector partnerships in mental health advocacy. The next speaker is Mr. Komolafe, no, sorry, Dr. Abdullahi Mustafa. The key issues we got from his presentation is also the issue of stigma and cultural barriers. And the recommendation is sorry. Stigma and cultural barriers, which makes mental health issues remains pervasive, making it difficult for employees to seek help. So the recommendation we got there is for the organization to give the employees assistance program, which he titled EAPs. And then the issue of awareness campaigns, it called for efforts to raise awareness about mental health through workshops, seminars, training sessions for employee and management. And then the issue of leadership training, recommendation is that managers and supervisors must be equipped to recognize signs of mental health distress in their teams. Then flexible work policies, which is the recommendation under pressure at work, and collaboration with mental health professionals. Basically, this is what we were able to collate for now, and we hope to give a full report of this at the weekend, which we hope will be put on the platform. But to cap it, what I want to say is that I have experienced, especially the issue of social media, whereby most workplaces, especially after COVID, whereby you have to work online. I know I have a son who works with one of the private sectors, and he's on from morning to early AMs because he's holding meetings and online, and then with different parts of the world. And so part of the things we also recommended to him was a lot of exercise, which he makes sure that he takes time off to have exercise, and then to take walks within the environment. But generally, like Dr. Mustafa said, the journey ahead is quite challenging, and especially for us in a country where we are not open to medical mental health medical services. We've had women also that have had after delivery that have mental problems, which was not understood by the society. So to cap it, I want to appreciate the planning committee again for giving us the opportunity. Sorry, our report is disjointed, but we hope to put it together and present it to the planning committee. Thank you.
Thank you very much, Mrs. Miriam. Thank you. We can't thank you enough. Can I invite Dr. Musa Rabiu, Executive Secretary of PEEF Abuja, for a vote of thanks and closing remarks.
Thank you very much. I think I can see that we have had a very successful conference, and indeed, my role is basically to say thank you, but I have something that I will quickly go through so that I'm sure I've not miss out the key messages. Okay, so if you can see my screen, so that is it. First is to appreciate all those who have been able to attend this conference, which theme has been quite topical because it's in direct support of the recent Act of Parliament on mental health in Nigeria. So we're pleased at PEEF that this conference has focused on that aspect. As a non-profit organization, our intention always is to focus on practical ways to enhance the human capital development in Nigeria and by extension in Africa. So we do this, as Ahmed Mohamed has indicated, on different platforms. We have the PEEF knowledge sharing platform, which is quite vibrant, and we encourage those who are not yet members to indicate their interest. I've provided a contact where a text message where WhatsApp can be sent. 2 persons have done that and I've responded to them. We also have the PEEF Career Opportunity Group. It's also a WhatsApp platform where issues related to career jobs are also, trashed out. And we have a flagship program, which is a quarterly or a bi-monthly, event, the PEEF Virtual Talk. We invite experts, subject matter experts, to also help us trash issues. And this year we focus on 6 thematic areas. And I think next year we will be looking at experts here who have a lot to share to perhaps revisit this topic on mental health issue. And Dr. Yekachi, Dr. Komalafe, and others will be considering engaging you for 2025. For this conference, we had over 120 registered delegates as at the last count, and over 80 attendees from within Nigeria and across Europe and North America. I've been tracking the attendance. I think we started with 40, it went to 80 something. As at the time I started speaking, I think 40 something or 50 something rather. So I think we have a good retention of delegates because the subject has been quite interesting, indicating the conference has been successful. I extend my heartfelt gratitude to our esteemed chairman, BOT, Alhaji Engineer Abdullah Bukar, who has always been there to give support and leadership to our efforts at PEEF. Also, the chairman of the conference, who gave us keynote address. I know that came to him, a request came to him as a surprise, but We have really benefited from the insights he presented in his speech. The speakers have been fantastic. Everybody has been demonstrated subject matter expertise. So we really appreciate the value addition at this conference. Our moderators, Ahmed, Onyekechi, thank you so much for the work you have done. The team of rapporteurs, I know the job is not complete yet until the draft communique is prepared, but we know you have been quite busy, you know, as the conference progresses. So we really thank you for what you have done. The IT support team is always quietly behind the scenes, so we also appreciate the support that we have received from them. I just want to say that PEEF will continue to encourage young professionals in its activities. So Dr. Jamila Musa is an indication of that, and we're going to do more of that because you know, we're looking at generational, you know, continuity. For the conference planning committee, I really appreciate the initial enthusiasm of the leadership of that committee. However, you know, the expected delivery was not met, but here we are. We have had a successful conference. Most members of this committee have contributed positively to the success of this conference. I'd like to acknowledge in particular the support by Dr. Shaibu Musa, who is the Group Chief Medical Director at NISA Premier Hospital, Abuja. And in fact, he was the chairman of the CPC in 2022. And we had also a successful conference that year. I urge us to carry forward the knowledge gained here, fostering a community committed to mental health awareness and self-care practices. Together, we can create impactful solutions that enhance well-being. In terms of next steps, and I observed that the chairman BOT had already hinted in that direction, beyond the conference communique, we will have to set up an action team. And we have from the, you know, personalities here, particularly the speakers, that will form a team and begin to see how we can explore the collaboration with the Federal Ministry of Health, particularly the minister himself, if we can do that, or other key directors in the ministry, so that we demonstrate that beyond a conference, PEEF is willing to support the implementation of the new national policy on mental health. Finally, I thank you all and look forward to further collaboration in the coming year and beyond. Thank you so much. And that is it from me.